Assalamu alaikum. Welcome back, viewers. Di leen nuyu, di leen santa. Ismaila dellusiwaat Kampe Jambar. Still season 2. Naa laaj boy fan leen nekkoon because nit yaa ngi doon laajte fan leen nekkoon. But kontaan nuñ dellusewaat di jaajëfal ñu di dee seetaan. Suñ last episode bi on HIV xawoon naa yëngal dëkk bi tuuti nag. Benn ci bari tiitoon nañ waaye ñun ñu dee wax ne suñ dooree di waxtaanee yéena yi the reason behind it mooy nekkut pour tiital nit yi but just full fàttali ko nit yi ne wérgu yaram dafa bari different aspects yoo xam ne dañ ko war a bàyyi xel waaye tamit wérgu yaram bu nekk di sonal nit yi am na healthcare professionals yoo xam ne ñu ngi taxawal liggéey bi daf dee métti te léegi-léegi du dee doy so di always ama dee jégalu nag di wax ne ñun tiital ñun ragaloo ngeen jégal ñu te yéen si suñ kilifa yi ñu ne léegi-léegi ñu dee wax daal xale yi nekkuñ di ko wax waaye jamono buñ toll nii waruñoo yaakaar ne xale yi xamuñ ko parce que ñoom fii lañ dëkka so pour ñu wax leeral moo gën dañ ñu bàyyi lii mu yar leen parce que àdduna bi ñu bari fu mu nekk nii suñu rakka yu bari lii moo leen nekk di yar te xamuñ lan lañ nekk di seet because àdduna bi mënuloo control social media bi tey nag special episode la because dañ am special gan boo xam ne maa moom we go way back waaye bala ñoo dugga damaa bàyyi booy ngeen nuyu wante ak askan bi wax niti foo leen demoon kuy door
asalaamaaleykum Gambia asalaamaaleykum donc di wax gars yi namoon naa leen xam nañ ne namoon ngeen ñu because of receive nañ a lot of messages from people ñu laajte gën ngeen ñëw soo leen gisee rek ñu jële break rek xamal ne ñi ngeen tooga lu rëy si loolu lañ nekkoon nag tooga nañ ba mu bëri tey ñu ngi ko ñëw yàq te nag bëggoon nañ bokk ak yéen lekka bi pour ñu coob donc di la nuyu
waaye tey glace si nag
waaw tey fii na parce que topic bee ko laaj rek
topic baa ko laaj
topic bee laaj glace yi soo ma def ni di dalal suñ gan bi Dr. Jaiteh welcome to the Kampe Jambar di wax na nag tey nag dog ñun Kampe bi daf dee jax de are you ready
waaw tey dafa Kampe doo ko laaj kañ la gëj a Kampe
kañ nga gëj a Kampe sax waaye dina ñëw moom
dina ñëw
di ko dalal
Baake moom I like the look Baake moom mu ngi dem Clark Kent xam ngeen Clark Kent am na Superman bi mooy Clark Kent bi explain look bi the glasses xam nga yaa ngi it's a new look
no waram rek docteur ba moo be content na ba fele am content da Baake an ñu mu buña de Cameroun nan Kampe ko tege pour ñu mo le kacha par comme doc ya fa ñame fali ndingo kata comme na fa ñame data break la nan ku mol ba la ñakala sul ñene ngi
kañ
Omar manam bi yemuna tabi nak barakana ke dura ngoti de
no bi me force la because of dog mba yenga la nak
no sugar
with no sugar
Pap bala nga nuy askan dama bëgg nga taxaw because dega Pap kola bi dem na Pap is in shape ñu ngi ko doon tooñ parce que dafa takkoon seet luy secret bi
dama dellu si gym bi tey
waaw nuyu askan bi no but you look good though you honestly look healthy and fit
xanaa coppaloo am si boy
landlord bi moo ko jox stress moo def bi nga wàññeeku
nuyu askan bi
donc jërëjëf waaw man balaa ma nuyoo rek ma starté fi nga daanale comme noo ko waxee rek kilifa diine yi nekk si dëkk bi ak kaddu yuñ fi jotoon a jaaral few couple of weeks ago wax neexut te dégg-dégg tamit dafa am solo fii nag Kampe la te Kampe léegi mu jaar yoon léegi du jaar yoon waaye ñun suñ message rek pour sensitiser la ak educate public bi waaye doomi aadama nag doo jóg si di jànga réeroo amul ñaaka waxtaan a am su dee jàllale neen fi benn kaddu boo xam ne nii nit rafetlu wut ko that wasn't our intention our intention was to educate the society and to sensitize the society ñu ngay jégalu ñëpp di baalu aaxa ñëpp because ñu dee seetaan dañ bëri am na kilifa diina yoo xam ne nii foo tollu Kampe Jambar from the hospital from the province from Farafenni every now and then ñu ngay follow show bi te ñun ñëwuñ fi pour yaaxa waaye Kampe moo demee noonu te waxtaan saa yu mu jógee rek different opinions dina am different perspective dina am waaye dégg-dégg yi tamit dina utee waaye ak lu mun si demee rek in short su dee wax neen fi jàllale neen fi kaddu boo xam ne neexul leen ñu ngay jégalu Kampe bi nag réeroon neen comme na ko Omar waxee rek ñu doon jaxas mbaxas ñu doon tooga xam nga parce que Kampe léegi-léegi booy loos waaye ñëwaat neen nag
waaye laaj leen ma man fan laa demoon.
yow fan naa yaa ngi woon fële de.
suñ koñ.
Washington DC si taax bi.
dama ayee ji woon.
Amérique neex na dox yaa ngi neex.
bu dee déggoo la dafa ayee ji woon.
dama demoon neexali.
da nga war a so donc ñu ngi dalal suñ gan bi docteur Jaiteh ku oyof.
kay.
nit ki am na ñoo xam ne dañ am xam-xam ba pare boole si oyof ak dal. so he is one of those. ñu ngi laa gërëm di la dalal si campé bi di la wax ne fii nag daf dee ja.
xam ngeen ma moom how long we go back. gis nga am na ñeene yi. xam nga soo leen nekkee ay morom. wala ngeen bokkoon classe. nit yaa dee beetu suñ gisee nit aaga yéene yi waaye yow doo dee beetu.
xam nga ko.
parce que yaa nga ko xam. as well too. ñu bari they know the version of me balaa Gambia di ma xam parce que ñoo bokkoon class I've known him.
Gambia
no Mrs. Ndaws. middle school. bu mu just del see Gambia waaye du naa ko bàyyi mu just story bi but obviously suma xarit la njëkka dafa yàlla tax rek ñun ñëpp ñu dem jàngi. del si waat continuer liggéey xaritoo bi continuer si. waaye xarit daf dee baax nga am xarit boo xam ne you have over 20 years. waaye respect and admiration bi mu ngi fa. so lu mu def rek. nit la dee better waaye man duma dee better because he's always been one of the smartest people I've known ñun suñ classe xam nga badge bu nekk dañ dee bàkku man dama dee wax ne class of 2003 Lamin Jaiteh Muñaan Cox Kani Joe Fatmata Ndour Jatu Jay science class Gambia High Methodist Academy xaw ma yeneen batches de waaye class of 2003 non dañ fulaloon jàng.
2003 yaa ngi grade ñaata.
yéen a ngi grade ñaata.
2003 boobu maa ngi toj primary school.
primary 3
nga naan
3 lañ nekkoon de.
da nga dëgër fit.
maa ngi toj primary school bro.
yéen a ngi woon primary school. waaye yéen a ngi wane suñ. yéen a ngi wane suñ at. non waaye xam nga lu ñu waroon def ñun suñ bàcc. ñun ñëpp dañ doon jógee Mrs. Ndaws dem Methodist. that was the plan. so man ma doon sit grade 9 ma bina Methodist lay dem. suma papa kéne ma Methodist mu ne bàyyi foo sama dem Gambia High so noonu laa réeree ak ñoom Lamin continué dem Lamin Methodist Academy waaye xaritoo bi has always been there so just di la welcome Jaiteh Kaba Dr. Jaiteh mun ngaa introduce sa bopp introduce yourself but just tell us who you are a little bit as well too what you do and then obviously today episode be the reason why this is important tey la October 1st xam ngeen ne ñu ngi just génn si month boo xam ne ñu ngi doon bring awareness around prostate cancer te October moom Pink October lañ ko dee ooyee àdduna bi yëpp dañ dee xam ne bii fu mu nekk nii breast cancer awareness month la waaye nit ci bari soo ne breast cancer dañ dee foog ne jigéen ñi rek la right moo tax tey ñu indi nag docteur boo xam ne mu ngi dedicate life am so much the past few years Gambia around cancer as well too so tey episode bi moom will touch a lot about cancer waaye moo tax suñ indee nit daf dee baax nit yi tax lu tax moom ñu indi ko because pour docteur Gambia yoo xam ne they are under 45 years old Africa pour man there's very little people ñu amee dëkka wàllum cancer si dëkka than Dr. Jaiteh as well too so really really honored that you welcome our invitation te tey Kampe la so bala ñoo start when was the last time Dr. Kampe ask him that question kañ nga gëj a Kampe
before the end of the show I'm not in
but it's been a while but welcome
it has been and I'll just take off from where Ismail has stopped Digala it's been a very very we go back like way long time but I think one part that you forgot to mention is that then don't play basketball at
Yes.
YMCA
Yes.
that was our pastime
but loolu moo nekkoon suñ sport nag
that was our sports
Huh?
yeah
foofu suma doole la woon paa
yeah so one thing is when we thought that he was going to make the NBA I have not when you're right
so is moom comme time school am nii comme nii la active on vocal bugga yëfi
yeah kind of dafa xaw a change nag waaye
I've changed
so time school moom mi da nga kaamoon nii
no but I was
public
speaking mi moom yaaga na si
you're gonna see like yeah
boobu suma doole la
that was his thing basketball and public speaking
X Y and Z la
nooy paa suñ daadi dañu yaaxa man ni ko retire na xaw ma ban sport de but honestly ñun suñ era
basketball
a lot of us could have been professional athletes waaye suma papa waxtaan bi bu ko start sax
bu ko ta dégg sa jànga rek
waaye dañ daan doxal religiously man yeah that's
It
true
was good, yeah. So thank you, for welcoming me to Campevi.
I'm not all of you I'm not ko how yeah, so it's great, being on the show and come Ismail go ahead. Every year October it's a big celebration. Talking about cancer, especially women's cancer. I'm not as a campaign jambar mom. Si góor lañ dégg naa yëngatu waaye xam naa ni tey moom dañoo waxtaan si suñ lingeer yi tamit exactly. So kan mooy Dr. Jaiteh. Dr. Jaiteh professionally mun naa wax ne I'm a doctor, surgeon, consultant, general surgeon, and dama subspecialized mooy from general surgery I went deeper into cancer surgery. So I'm a surgical oncologist. I'm privileged to be the only one in the Gambia who's had training in surgical oncology.
Repeat. At the age of what? I'm going to talk, these are important, right? Because this is Gambian professionals, right? Right? Specialization under the age of 45, Africa, he could be anywhere in the world. Anywhere in the world.
Sure. Yeah, but I mean, home is home, and try and see what we can do. Yeah, so basically professionally, that's what I do. I also run a foundation called the Solace Foundation. That is a nonprofit that is into community activity, within the country. So from Banjul all the way to Koina, we've been to different villages. Unyunwa said how we're going to sensitize people, mostly on chronic disease, hypertension, diabetes, but most especially cancer. So female cancers, we've had trainings for people in the villages, who don't have the opportunity punyo Banjul or combo for treatment. We've trained over 300 healthcare personnel, so both doctors, nurses, midwives, and nurses. On cancer awareness, on cancer detection. So it's something that we're very, very passionate about. Then hamne su fekkee ne dañoo toog si lopitaan bi rek and think that okay, mun nañoo solve healthcare problems si dëkk bi moom is impossible. Mostly su ñëwee su ñun, it's already too late.
Yeah.
So balaa loolu foog ñu jóg and then you them see askani. We head to the population. So that's the rationale behind Sun Foundation be. Just to make sure that we go forward and be able to, prevent some of these conditions before they're too late.
How many years of training with surgical oncologists to get to that point? How many years? Because, by the way, he went to school. He went to school and you did French speaking.
Tu parles français?
Un peu.
Un peu?
Oui.
But he studied medical school in French.
In French, wow.
Yeah, that sounds like a decade or 15 years ago.
So how long does it take? Because we have a lot of young people that watch the show and they're going to be inspired because once again, for somebody under the age of 45 to be specialized at that level, how many years, and training is ongoing, but how many years does it take for somebody to arrive where you could call yourself a surgical oncologist?
Good question. I don't want to discourage the viewers out here, but okay, let's break it down and do the math.
Right.
So basically, a doctor, it's basically, it's about 8 to 10 years, depending. Because then they janga, and after your studies, you do what's called an internship. Moi, then they have temporary license, got practice under supervision. It's because hamnenye dome adama, and the body is sacred. Understand. So you spend almost a decade of your life, studying the human body. Balanga, I'm licensed.
10 years.
Yeah, 10 years before you practice. Some countries a little less, but Gambia, it's 10 years basically to have your full license. So Lolu specialization, general surgery, it's about 5 to 6 years.
Oh.
And then surgical oncology is another 1 to 2 years.
Wow.
So again, overall, it's about 18 years. So I'm done.
Done the high school.
Done the high school by the time you're done. Exactly.
Right? Because deka bifi sayineka then there was scope of practice. Respect like the amount of work. Swing doctors, swing consultancy, they janga, they aga. What in your chahane lolo? Because yaram nitkuneka yaram bena yaram gam.
Definitely.
18 years suñ jamono, how many young Gambians ñoo mën a dedicate seen bopp waxuma la si 18 years sax 9
moo tax nga géej a campé.
ah naka laay campé
géej a campé.
fan laay campé
Wow.
no because you spend half of your life in school
Yeah, definitely.
right because ku nekk under 45 years old and nga dedicate Now's Comprehensive Gambia Methodist Academy and then nga teg si 18 years. It's a long dedication, but also something else in terms of, because surgery, a lot of people, maybe they don't understand how different a day of a life of a surgeon is compared to a general practitioner. Maybe they're not. What's the psychology of, okay, you've seen a lot of human parts in your life so far. How different is it, or how has it changed you as a person?
On a lot of levels, I think physically, spiritually, and even socially. Physically, coming in medical school, obviously, and this is normal, you transition from, seeing people on the outside and then on the inside, so I've had like companies who are classmates and stuff who, since first day in the operating theater, they would just faint. Because then it'd be more, this is like, it's really difficult to stand. Why? With time, they kind of get through that. So there's this physical transition wherein you're able to sort of stomach seeing somebody on the inside. Again, just looking at it, you look at a person and then you see them on the outside and then you're seeing their intestines, their liver, their heart and stuff. So, I mean, there's a transformation that goes on, on that. Spiritually, I guess God is the ultimate creator. Because you get an operation on something that you haven't created, but it's so perfect that I guess the neck operation is what is going to get them to get to that stage. You're just setting things up in order.
Wow.
And it just tells you, we haven't been able to build as human beings any machine that could rival the human body.
Wow.
Maintenance 10, 15 years, that's it. Lifespan be mom, it's gone. Whatever mom do not had. But a human body is so resilient that I guess people who take care of themselves, and this is where healthy living comes in. Good diet, exercise, physical activity, and all that. And I guess if you're feeding it the right stuff and you're doing the right things, you can live up to 70, 80. The average age in median age, in Japan is over 78.
Yep.
So again, you just realize that the human body is so resilient, and it's only a superior being who can actually create something like that. So again, the transition is that you if you're somebody who's thoughtful, you tend to appreciate human life. And is the ultimate creator. Exactly.
So I'm gonna lead a guy. One you are even in the labor room, delivery room. I'm help. You don't think about those things that people are thinking about.
So, Doc, what I want to ask is, we all know the road to success is never easy to navigate, and 18 years and 18 days, So what actually motivated you to take this path?
That's a good question.
It's a good question. I think I'm not in school. You ask any school-going kid, they'll tell you three things. Either you want to be a doctor, a lawyer, or an engineer. So but now, towards high school, there was this documentary was a film, actually. I don't know whether you guys have seen it. It's about a great neurosurgeon called Ben Carson.
Ben Carson, Gifted Hands.
Gifted Hands, exactly. That movie. So I watched that movie and, I realized that because Coco, he is a Black American in America. The mother was, uneducated. She was working 9 to 5 and, she was barely getting by. And, she was able to bring up this young kid who was a Black, underprivileged environment, and then eventually became one of the top neurosurgeons in America. And looking at a story like that, how somebody from, small beginnings can have a huge impact that can go all the way global, was something that was inspiring to me. And the second thing was that when I finished high school, by then observer and don't get a read,
Yeah.
And then you would see on the stories, a baby who's maybe 6 months old, has this condition, and they're asking for assistance. Like Facebook is why at that time
It was Observer, yeah.
exactly.
Yeah,
It was on
yeah,
newspaper.
yeah.
So almost every single day, then I guess that says that so and so and when you look at it, some of those conditions are not so difficult to manage. Why? Maybe it's lack of resources. Sometimes there's lack of, human resources, meaning that specialists within the country. So I guess that this is something that, I already have the passion to serve. And medicine was one of my options. And then, this just made sense. How can I contribute to making that less of a problem in the country? And that's what took me into surgery. Not that the other doctors are not okay. Then I'm, hitch onto.
There's like a rivalry.
Between doctors who operate and doctors who don't. But I just felt that, the impact for me would have been greater. So I went into surgery, and that's something that, I still am happy for that choice, because I'm not at the face, of somebody, maybe they come in with their, husband or their father, and then you do a successful surgery, and I guess you've changed their lives. You've really transformed them. So that gratification is something that keeps pushing me, to move forward and try and strive to do better for people. So definitely, I think surgery was a calling.
Yes,
It was definitely one.
I was just gonna say that surgery also chose him. Because temperament is important. Honestly, in high school, if you ask people like 2025, Dr. Lamin, Jaiteh, surgical oncologist, yes, because God time gives you as well too. But I think one of the things too in Gambia that's very unique. It's never too late though. No, I'm not a pilot belegi. Hey, na can do a plane. Pilot can. So no, why? I'm private license. Private license. It's also not too late. It's never too late. But modern pharmacy program, there was a 56-year-old police officer who buga turn life and make a doctor of pharmacy and went back to school. It's never too late. Your surgeon said, you're 18 years old.
It's never too late. But you long,
right?
Go into it, my boy.
But Doug, what I also want to ask is, because Gambia is also unique. So two things. Why did you come home? But also, no. And even where you grew up, did that influence it? Why did you come home? Wahamga Gambian said, if you take our doctors, right? How magi? Because these people are my colleagues. If you take Gambians 50 and above, our doctors, you could take them anywhere in the world and they will be the best doctors, the Dr. Jaiteh, Dr. Bitete, Edward Francis right now, because he's the head of the surgery department. The level of leadership that is Gambian led, Edward Francis, revolution people are just not paying attention. The level of young leadership, director of health service, deputy director of health service, all these people, we knew them as colleagues in school. So why did you come home? And also, how difficult has it been managing leadership in a country where if he was in anywhere in the world, right? He walks on water in most countries. Like if you're a surgical oncologist, the tea you drink, right? So why did you come home? Why are you still here in the Gambia? Because per hour, what you are worth per hour is more than some people's like monthly salary. But also, why still even leadership at that level? I really want you to touch on that because it's a choice. Every single day, you choose Gambia. Why?
Yeah, I mean, it's a good question. And, there are days where I ask myself, what am I doing here? That happens. Don't get me wrong. But I think more often than not, I think I'm happy to serve. And the reason why I say that is Jangana outside, I've served as a doctor outside. Why I guess that there's a certain feeling of gratitude and gratification that you get fee musmako feel anywhere else. I guess that and sometimes it's not even big stuff with surgeries. You get somebody who maybe is not feeling well and then you prescribe drugs and they're okay. But I guess the Gambia like is somebody who's sick. And it's a very sincere prayer.
Yep.
Lulu, I mean, the feeling that comes with that, this is not something I can get elsewhere. And the impact as well. We don't have a lot of doctors here. We don't have a lot of specialists here. I'm on a time, in Gambia, Senegal.
Yeah.
Was in Senegal.
Yeah.
Which there's absolutely nothing wrong with that. Why I guess for some people, it's not by choice. It's because they don't have any options.
Yeah.
And there are so many other Gambians out there. So I mean, opportunity to come back home, they definitely would do that.
Yep.
So I think there's something unique about the Gambia, that just makes us Gambians want to contribute. We get there at different stages. They're really trying to see how best to make the transition. There's no doctor friend of mine who I talk to, whether it's in America, in the UK, who doesn't have plans to come back. Sometimes I guess the environment is not right, or maybe they're waiting for certain things, whether it's in their personal lives or maybe professionally. Why ultimately most people I speak to, they all want to come back. And I think it's just that feeling of satisfaction. I mean, you cannot get that feeling. It doesn't matter how much they pay you. And that's just the trade-off. I mean, you can earn way more outside. Why being in the Gambia it's just a unique feeling. And when it comes to leadership, I think it's important. When you look at youth, time before you even become a leader, you have to start having gray hair. And that kind of stuff. What I guess recently in our generation, leadership is not related to age. Although some old people are still pushing for older people.
Yes.
But again, I think leadership is just being able to create a vision and have a sense of direction. So Lulu, at the end of the day, you're able to achieve your objectives because no matter how difficult it is, no matter how different we are, we eventually have things that are in common that we want to get to. And my objective when it comes to my department, for instance, is to create as many young leaders as possible because that's how we're going to move forward. And seeing that it's possible to be young and lead, I think so many others would step up. And I guess the reason why sometimes we don't get the results we want is because the people who can lead are not leading, are not taking responsibility.
Absolutely.
So I guess we can't go forward. And complain. This is not working, that's not working. So we need to take the bull by the horn and lead. Obviously, it's not going to be perfect at the beginning, but you learn as you go through and you gain experience. And then eventually, you can hand over to, the next generation. So that's really a push factor for me.
Well, it's a service to nation. Gambia, there's something special that's happening at Edward Francis, and I think we need to pay attention. Why 80s babies, it is our time to lead institutions in the Gambia and be the change that we want to see. If not, we will be the lost generation. How many why 1980, but 1990, ñooñu suñ time la fu mu nekk nii because 70% of the population I think is under 35 years old. So ñun mënuñoo xaar pour lead. And I think the beauty about leadership, key private sector, key public sector, we knew each other as schoolmates. I'm nga kii su bari woon caaxaan suma yaay soxla surgery ñu ne ma doctor Jaiteh moo nekk surgeon damaa ne no, right? But I think it's very, very important. So your story is really inspiring, and hopefully with the kids that are aspiring to be also physicians, just know that you could be a doctor and a leader at the same time too, because there's always been this notion that if you're a science student, you don't have soft skills. You cannot speak really well. You cannot communicate. You cannot lead people. So we want all the art students to be the leaders, and we need the commerce students to be the auditors and the accountants as well too.
Dr. Kajali Kamara ak Keba Maren. They follow Sobe every time.
The young leaders, man, lumade one more young doctors under 50. Any deka bu pare rek nañ dem. We set up some all-star team, right? So inshallah, more Gambians will have trust ne tuki bola de tuki. Dem Dakar wala dem yenen place you're leaving better services here to go there. So really, really inspired by your story, Doc. What does your average day look like? How long do you work? Could you describe your typical day where when you go home, you just sometimes even just fall asleep on that? Because Halatal, 1 out of 2.5 million people, there's only one of him. So how thin, right? Just give people context. The day in the life of Dr. Jaiteh, if we were to follow you for 24 hours a day that you're doing surgeries. How
did you even manage to get him here?
Wait, what now? Relationship?
Yeah.
But what is the average? And how many surgeries do you think you've done so far in your career?
Wow. I mean, you're putting me on the spot right here. I think in a month, depending, because again, you have minor surgeries and major surgeries.
Yeah.
But if I'm looking at total surgeries, I can average anywhere between 30 to 50 per month. So again, been practicing for about how many? 12 years as a surgeon.
Good God.
Yeah, so, yeah. So anyways, I'm sure the math people.
Is your worst day and your best day both at the surgery room?
Yeah, pretty much.
Yeah.
Pretty much. Again, just talking about how my day goes. I mean, one thing I do know, I wake up and say that this is how I plan my day.
Good luck.
And then, something else happens. It's a completely different day. So at night, I mean, yesterday I think we were texting almost at midnight.
At midnight, yeah.
That was the time I got home, and then, I was trying to reply to my messages.
Wow.
So I had an early start at 8 a.m. and then, finished at 12, midnight basically. So it's a mixture of, work in the hospital, because I also am a lecturer, a senior lecturer at the University of the Gambia. So I lecture surgery to medical students.
Wow.
I'm also a trainer for our Gambian-grown surgeons. So I train Gambian doctors who have gone through their 10 years and are sort of specializing to become surgeons. Yeah, so that forms the core of my day. So basically, it's hospital work from 8 o'clock in the morning to 4. So that's a mixture of lecturing medical students, sort of supervising and guiding residents in their work, being in the clinic, seeing patients, and also doing surgical procedures, within the operating theater. So in the afternoons, I also see patients outside the hospital because, again, with what we're doing in EFSTH, there's only so many patients we can see. There's a limit because obviously in terms of space, in terms of personnel. So those who prefer to be seen outside, I do see them at a private facility. And that goes anywhere from 5 to maybe 8 or 9. If I have surgeries, it can go up to 10 p.m.
Wow.
And then eventually by the time I'm getting home, it's probably 11, 12.
So when do you find time for yourself, and what do you do that is for yourself?
I think Sundays are off, basically.
Okay.
So that's something I definitely try and do.
Yeah.
I try and create family time because I think it's really important, especially with the kids, in as much as, we're serving the country and the community, but I think we also need to come back home and try and see how to reconnect with family. Well, I'm going to...
No, but it's just a sacrifice. And I'm just glad we're putting it out there. That we never know.
Definitely.
They are really, really in a way that it's mind-blowing as well too. So thank you for sharing that. I mean, you're really one of the heroes in the country. So cancer, Doc. What do you think cancer is? So when they get cancer, what do they think?
Cancer.
Loo foog.
Falaa bëggoon moom sax tey moom nga suma fi toogee askan bi laa fi toogal.
Wow.
Man dama assume I have no idea about what cancer is.
Wow.
Layman in the street. Time bu ñu nekkee xale lan mooy cancer. That's how I'm gonna give the definition of cancer tey. Cancer doc ñun jamono yooyu suñ déggee cancer dañ jàpp ne benn feebar la buy ku ko am daal yow dangay dee.
Yes.
Right?
Yes.
nu ma ko waxee dis na nag.
non waaye loolu laa
nii la ñu ko doon waxee.
loolu laa bëggoon nga xalaatee ko parce que xam nga épisode HIV bi ñu ngi doon wax ne bu njëkk bi suñ déggee ne HIV dañ dee foog ne dee la.
automatic death.
Cancer tamit in Gambia is almost similar that way.
noonu la so time boobu lu ñu su jigéen yi especially jigéen cancer sa ween bi lay téye su ko téyee moom dañ koy dagg.
waaw
yooyu yëpp dañ ko doon dégg.
suñu askan bari na
suñu askan bi waaw jigéen ñi xam nga seen ween bi dañoo dagg moom des fois am cancer dagg nañ ween bi.
ay xamat tey
moom loolu nga doon dégg.
ay xamat
right léegi buñ jàngee jot nañu réaliser xam si lu bëri. bon si gàttal man noonu laa la ko définir na tey as a layman in the street.
moom xanaa si
yow nag
si lu mu dee nekk
si la
cancer bi moom si fan la si ween bi
ween
lu fa dee nekk
yow xanaa war a am cancer yow. yow mënoo ko am yow.
non damay laajte rek
bëri na
am
foofu day am cancer.
am na
foofu.
xanaa góor yi dem dañ
I'm going to my latte. So I did some research, Doc, before the show. And this is from GlobalCon, 2020 data. That Gambia has one of the worst survival rates in Africa. At the time, they reported it as 78% of people diagnosed with cancer will die from it. And I know you'll touch on a little bit the stage and things of that nature. But also on the flip side, our incidence rate is low. One of the lowest in Africa, which is a very interesting dynamic as well. In terms of leading cancers in the Gambia, and correct me if that has changed. For males, liver cancer, 58% of all male cancers. Non-Hodgkin's lymphoma, and you'll talk about the different types, coming in at number 2. Lung cancer, number 3. Prostate cancer, number 4. Maybe that's changed. In females, cervical cancer, leading the way. Liver cancer, breast cancer, and ovarian cancer as the top 4, right? But even before we go into that, maybe perhaps just explaining people what exactly is cancer. Because I think there's also this misconception that cancer is palliative care. It's hospice. Because also our relationship with healthcare, right? So why is it that based on explaining what cancer is, and then go into that to kind of dive into, okay, why do we have poor survival outcomes as well, right?
Yeah. Great question. And I mean, I couldn't have said it better. So hey, cancer there. That's just it. Cancer equals death, or you're gonna die. And notion bobo no, it's been ingrained in the society so much so that cancer, they don't even come to the hospital.
Oh wow.
They've lost hope. They don't think that they can do anything about it. And I'll touch a little bit on stage and that sort of thing. So I guess that's a misconception that we need to change. And I say, HIV, people have more hope. So HIV than cancer.
Yeah.
Again, it's because of the notion that's around cancer. It's because of what they see or what they hear about cancer. So it's very important to change that narrative. And it is changing. But people probably are not aware of it. And that's why October, for instance, it's a very good month. People don't know, for instance, September was a month for prostate cancer. October is for breast cancer. And so every single month of the year, there's a particular cancer that's actually commemorated.
Oh, wow. Okay.
So they have a cancer calendar.
Yeah.
Exactly. So Lolo, it just shows the importance of cancer. And Lula what's cancer? Because it's something that's a reality in our society. You talked about the figures. Before February, what do we talk about? Malaria, tuberculosis, chest infections, diarrheal infections, and things like that. Those were our diseases in most of Africa, Gambia included. So we were going from infectious diseases to non-communicable diseases. Moi February, I don't know how I'm going to say it. Duwala, exactly. So diseases that you don't get by being in contact with somebody else. And that's an important notion, Tamik. Then therefore the key so I cancer. Which is completely wrong.
It's wrong.
Indeed.
Cancer yep, gori bari. I'm glad that we're talking about breast cancer today.
Lum ko waxe dafa important ñeneen dañ la so melasta ko di nampa tamit mun nga ko ci am.
Lu melasta ko?
Melasta ko. Wa di nampa ween bi melasta ko.
Xam throat cancer am na throat.
Bo manam.
Déedéet waaye lan mooy melasta ko?
Donc melasta ko
How do you what lu melasta? No, I'm serious.
Melasta ko loolu baati olof la comme nampa bi.
Is it related to nampa? Lan mooy melestaku.
nga xale daf dee nampa mag dee nampa melestaku mag laa
Mag daf dee nampa.
melestaku mag ñu ne daf ko
docteur
dee
Jaiteh mu ngi ree daal mag
mag daf dee meleste ko loolu laa bëgg.
Mag fu mu dee nampa.
mag duy nàmp day meleste ko.
Omar bul jaar si diggal
leer na ko dog leer na waaye nga papa.
Man nampa si xale laa ko xamee ni.
mag daf dee
non dog mag yi dañ
non mag yi dañ dee barkeelu waaye dañ dee dégg si société
non xam nga tamit dog mag yi dañ dee joxe cancer.
si naka
nampa bu ëpp bi bi ko ñëw ni ko dee xëccee.
Déedéet si same déedéet.
ba continuer Omar
non dog
continue
ndax
It's good.
it's good. No,
Yeah, we need to talk about it.
No,
But like people think, you know,
no,
some
no,
people
no,
get
no,
involved
no,
and
no, no, no,
it's
no,
okay,
no,
yeah.
we need to talk about it.
Exactly.
na waaye ak nooy nampee
Pape tey cancer la ñoo waxtaanee gisoo ma sol suma specs yi.
Yéen moo tax ma ne gis nga xale góor maa ngi lis cancer yëpp lan lu affect weni jigéen bi rek
ñun dañoo itteel.
yéen boobu rek la itteel.
Omar gaa dañ la dee wax Omar dañ la dee wax ne am na donje bu fa nekk soo ko nampee urut non donc maa la société bi loolu leen dee wax
So no dégg la and
dañ
don't
dee wax ne am na soo ko laalee sax dañ dee daj yi donje soo ñu ne sooy namp avoid daal donje yi nga lu nekk nga dee dégg so it's good tamit ñu sensitive
no but it's
te root dog capana benn like journal la mi ngi wax mu ne oral sex is one of the causes of throat cancer.
yeah
Throat cancer yeah. So xam nga yooyu noonu yëpp tamit lu ñu war a waxtaanee la dog.
yeah ak BJ yi sax
dog bul smile rek bul lii bul smile dog.
Musa naan naa la passe suma musuwaar bi
baa ko
ñi
bëggee
serious bi
baa ko bëggee
So Omar lu may wax ni it's important am na solo torop because da nga gis ne am na misconceptions yu bari in the society. It's because, you know, people come up with explanations for things that they don't understand.
Exactly.
Yeah. So again, comme niñ ko waxee rek, cancer is a reality.
yeah
In ko gën a gis si dëkk bi and all around the world. So you know, when you look at the statistics, every year cancers are increasing.
Yeah.
You know, we talked about the Gambia and, you know, having the worst in terms of outcomes. And there's a reason for that. Although those statistics are, I think, about 5 years, there have been massive improvements. Well, I guess that one of the reasons not so good or bad outcomes in cancer, it's two reasons. I guess as Gambians, unfortunately, lunde oye health-seeking habits. Suñ amee dara si suñ yaram bi or suñ wergu yaram bi, the first port of call is not the hospital.
yeah
Dañoo dem si koñ bi, we get the traditional healer or, you know, so you have people who, you know, would go to non-medical personnel. Not to say that, okay, ñoom tamit amuñ xam-xam. They may have knowledge, but when it comes to cancer, the best advice is to go to the hospital.
hospital yeah
and they
It's
can't treat
proven
cancer
science.
But
came on karang mana ka ñene nga
kumbanyi na ka ni mande ka
babla on
ne ko ni ka ni mande ka
bag naa la man nañ ko
imamere fanan loptano do mol mi anko ka mol jara ila lundo dankatal do mon din kan tala karo kadon ka fengol be jibe bari wato do imamere kan nyina ko to jibe gado do ka mo le mol ka ban tara loptano do yambaro bi ko fam man taran and definitely they are not imang kende but they cannot tell them anything.
Yeah, so ibail ko na aketa cancer la diagnosis man fair. Cancer diagnosis hanni tata America. Itata no doctor ya draka AG ba ko cancer sort.
okay it's impossible yeah
So cancer diagnosis amanke mo jibe doron kai cancer sort. It has to go through steps. Even in breast cancer it has to go through steps. Prostate cancer has to go through steps. So ibail ko loptano nyim fanang hanni doctor soto, mi londo soto. Maybe cancer nyinto anyanta test do lekela puka jibe ko puka confirm for toyata nyimo cancer fama ke cancer nga omon yolbe fenne fo kan nun jang wala en ko nimbero be sunjoto ning yama wala niamo wala susu ibaylo hebe cancer soto but just to say that niaji be musul sursu jamal mimbe under 40 years of age it's normal pre sunju bero yeah it's normal pre asoto
Okay.
but ibaje la ko puri ya lonko it's a normal sunju bero wala cancer soto ito fonola weta doctoro ya and that's why it's important to actually get medical attention when you realize you have something that wasn't there before. I'll go deeper maybe into the signs of breast cancer.
Yeah.
But just to say that our health-seeking habits, so we're at sometimes the diagnosis on time. And you have an ultrasound,
Yeah.
not a breast cancer. Prostate cancer too, you need to have an ultrasound. Liver cancer too, you need to have an ultrasound. So if I dobeje sutru santoto, if I maybe with joran mantre bulu. So what we've been trying to do with the Ministry of Health and also the Solace Foundation, walen ka tamanserol akamta doctor nosol mimbeje purka itendela ko ni tamansero je wala yinje yanta referral to a higher center, either to a general hospital or even to Edward Francis Teaching Hospital. Ibayal ko wol joron bowol tole pour ya jibe ko nying breast cancer soto wala among breast cancer soto or whatever cancer it is. So no problem minti waleng mol buka taria kata loptanot. Jama either kata nying traditional fankol dala silola or ye but fona tardata na tardata hani tata America or anywhere else. Akam de ning sasa tata fa a balon yimbe fenke adunta balon yinkono. It's very, very difficult. Primary treatment also So October is very important. Because we're creating awareness. So it's not just about screening. That we do a lot of screening here, but more importantly is creating awareness so that after October, the women would know that, okay, I need to check my breast on a monthly basis, for instance. And whatever is not normal, wasn't in my breast before, they would eventually go to the hospital and get it checked out.
It's normal for women under 40.
I'm a
little bit.
So I guess but if a woman has a lump, it doesn't mean it's cancer automatically. 10 women. Out of that 10, all of them have lumps. Only 2 would have cancer.
Okay.
So 20% of lumps are actually cancerous. Why? The catch is whether you're part of that 2%.
So Doc, see that lump you talked about. So I'm not been sign or any feeling where muna feel bula muna one okay, this is serious. I need at least pour ñom at least so muna demonstrate pour jigen bi la wax
pour jigen
bi mom ci bopam pour jigen bi at least su fekkene tamit xamna ne if you want to do the exam maybe the breast you can divide it into 4 parts and then su fekkene tam you can just give them that tip as pour gift pour ñom ñuy sétan suñ ko joté xamna du ñaka amna ño xamné they are victims mun nañ try that for themselves su fekkene na gis nañ any lump then they can at least
maybe just a deep dive in terms of breast cancer especially and even the role of men because I think the reason why Lee said I'm solo moy buñ dugga ci octobre góor yi bari dañ lay joxe gannaaw comme ñoom bokkuñ ci
góor yi tamit dañ ci bokka
non awareness ñëpp ci bokka dafa mel ni last week lu ñu doon wax mbiri prostate rek right
and they have a very big role because I had a patient actually who came with a lump when a jëkkëram mi moo ko detect
seetal loolu
so
dañ gaa ci detect na ko nampa na ba gi
I guess the góor yi moom bokk nañ ci
man dama ci mëna ràññee
did it why no but it's important because it's true though because if it's intimacy sa jabar xam mooy ko amul jabar
waaw ñu amul jabar moom
waaye sa jabar yow war nga àgga place mun ngaa goma sa bët bi sax lu fa nekkut lu fa war a nekk dañ ko war a xam
waaye donjay tamit dañ utee de
déedéet dama ne su nekkee sa jabar somebody that's your intimate right waaye kii ñeme naa dafa naan kii dog ne donc salu non tey bi sukari docteur ata docteur la
diabetic
ñaari docteur ñoo fi nekk
boy gis nga bi lii mooy ataaya ok mun naa wax dara gars yi ñu ngi dugga si soj season yéen ñu nekk si campé yokkaleen kaas yi ku nekk kuy ñëw campé indil sa kaas yi boppa wala nga raxas ko because personal hygiene ñu ngi dugga si season boo xam ne last time ñu ne dama wax ne dañ dee fóonante du ma wax mbiri fóonante dama ne just ida ngeen raxas ko ak ndoxa saabu balaa every round waaye please salu boy sukkur bi
am na
yow doo xiimaat Pape
ñun am diabetes
but back si lu ma doon wax intimacy the role of men dañ war a bàyyi di wax ne ok lii wàllum jigéen la ñun ñëpp we have sisters we have mothers we have wives. To intimacy, obviously, if it's something that requires like a physical examination, yo, dara su fa nekkutoon lu fa warta nekka. Di nga laajte.
man kay dama dee laaj.
Di nga tak. So I think it's very important pour wàllum góor.
in terms of góor yi tamit because da gis su du jigéen yi rek sax góor mën na am cancer. Breast cancer.
Wow.
dañ dee foog ne suñu waxee breast cancer jigéen yi rek lañ.
góor yi tamit mën neen ko
am.
Yeah.
Although a very small percentage,
Yeah, small.
1%. Breast cancer, if you take all of them, 1% of breast cancer patients, they're men.
Yeah.
So Lulu, it doesn't seem like a lot.
Yeah.
Why? So maybe out of 100,000,
Yeah.
100 men on breast cancer.
Yeah.
Yun sa sila fitaan bi Banjul, every year we get about 2 patients.
Oh wow.
You didn't know, yeah.
loolu
Yeah,
la ko dee waral.
you didn't know.
góor yi seen bos lu ko dee waral.
Is it typically heavy set men or it really doesn't matter?
It doesn't really matter.
Because I know men have gynecomastia.
Yes.
Yeah.
I'm a gynecomastia.
mooy maanaam.
Pape nañ ko bëri non Pape nag defoo medical terminology.
nag tajol yax bi dog.
normal woon la rek.
man
Dafa
dama
medical terminology Pape.
tajol yax bi.
Gynecomastia. Mastia moo mean mais ween. Right?
suñ daara.
Gaana moom foog ne jigéen la. Gaana moom
man
foog
lu
ne
ma
jigéen la.
jaaxal ndax affaire man lu ma laajte mooy ndax du loolu moo ko dee joxe man suma xel dafa sori de.
Déedéet waxuma loolu de mu ngi laa wax ne 1% of all breast cancers are men.
1% boobu lu ko dee isi ma ne mbaa du meles topp bi.
Déedéet. So let's clear the myth that there is no correlation that I know of.
Well, I'm a light pap. Suñu waxee breast. Yow loo understand.
man kay dënn bi laa si xalaat.
waaw xam nga góor am na dina.
Waaw.
waaye am na wen tamit.
waaw bu ween bi meles topp bi moom laay xalaat.
Déedéet.
ndax loolu moo ko dee joxe.
Déedéet.
Xam nga lu tax ñun suñ bos tréyul. Ñun duñ dee nampal.
But it's hormonal though,
Non,
right?
hormonal dama la ko because ñun duñ dee nampal.
luñ dee la.
Ñun dee nampal. Ñoom they have fat and then low.
No, but hormonal profile góor ak jigéen are different.
So loolu rek la. That's the only
Non kii moom
difference.
am na góor yoo xam ne duñ dee nampal te mu ñëw pa yeneen jigéen ween.
Waaw.
Hormonal la rek.
Waaw loolu bu amee rek. Loolu la ñu wax bu amee.
But lu ma mean mooy the average góor so trying to say puberty it wouldn't come with enlargement of breast.
Yeah di.
loolu is different from.
Naka la góor di ëppee jigéen ween booy Omar boy.
Am na yeneen.
So what Pape is
But-
Pape mu ngi laajte nag gynecomastia is it different from obesity?
yeah.
Yes, it is.
Yeah.
So why obesity? And I guess the fat cells
Excessive
in.
amount of fat.
Wow.
Yeah.
Why it's in such a way that it's proportional.
Yeah.
And I guess the fat B, so it's around, and I guess it's proportional. When you see it, I guess the person would be big.
donc kii
Why?
dafa kii dafa xam métier bi.
Listen, why gynecomastia? From now on, we
Breakdown.
breakdown. So gyne means women, related to women. Mastia means breast. So the family gynecomastia.
Medical terminology laa ko bëggoon breakal daal.
Boy yow da nga pass medical terminology de.
bu ko faale.
Ay wa ñama
bu ko
sonal
faale.
rek.
Yeah, so lolu boy si góor yaa ngi gis, big breast. So lolu soo xoolee da nga gis ku laapa sax mu ngi am big breast.
Yep.
So lolu du mën a nekk obesity.
Yeah.
Lolu moom there's something wrong.
Yeah.
Obviously there are hormonal changes.
Yeah.
Why lolu is different from góor mu am breast cancer.
Yeah.
Góor mu am breast cancer, there are risk factors. And da nga gis ne góor ku am breast cancer si góor moo gën a graaw
Bu jigéen.
bu jigéen bi.
Oh wow, okay.
Yeah, it's worse because jigéen when I'm dafa there's enough space. So the guys donja, it takes a bit of time. Bala mo laal
Metastasize.
yeah, and also yahbi. The chest bone. Like for a male, I mean smaller breasts. But if I'm in the donja bututi sa, it could start touching the bones and the muscles and things like that. So lolu, it means that it's a worse prognosis, meaning that feebaram bi moo gën a graaw that. So again, men should be careful. What you wax ne okay, it's just women and ñun bokkuñ si.
fagaroo moo gën faju de.
No, and there's other types of cancer that affect men. Prostate, testicular cancer.
I think it's the commonest in men there, right? Prostate.
No, I think liver cancer, right? In Gambia?
In Gambia, yeah.
Liver cancer.
Gambia,
Yeah.
liver cancer, yeah.
It's only liver cancer tamit
Liver
lolu.
cancer is bad.
there's a reason for that.
Yeah, of course.
You know, in other countries, it's lung cancer, it's prostate cancer, for instance. In Nigeria, I think it's prostate cancer. That's number one. But in Gambia, Sokohole, it's liver cancer, and there's a reason for that. You know, when you take cervix and sometimes even breast is number 3 to liver cancer. You know, the reason for that is because liver cancer, Sokohole, you know, Doc Munonwa, you know, kasi ataya, you know, although it's a very limited or small risk, but liver cancer is due to an infection, and most often it's hepatitis B. You know, lulu munaneka in saliva, it can be in the blood, so it can be transmitted sexually as well. So the guy gets the lulu Gambia. You know, although I mean there have been studies, you know, since the 1980s, you get your vaccination. You know, MRC and the government of Gambia played a big role. In fact, Gambia was one of the champions when it came to, you know, vaccines against hepatitis B. And, you know, Gambia is a reference when you talk about, you know, hepatitis B vaccinations. Why, Jaiteh, we still have cases of hepatitis B. So there is a liver cancer. So I may hepatitis B. It takes about 15, 20, 30 years, more, you know, damaged liver B. It's a chronic disease. You know, so more than vaccination is very effective because if you vaccinate children against it, then I guess you prevent hepatitis B and even liver cancer, you know, from developing. So the non-start vaccinations, I think in 1980, mandatory vaccinations in 1986, I think. So I guess, you know, it's more our generation that, you know, kind of got the chance to get that vaccine. Why people prior to us didn't systematically get vaccinations.
But at some point, you don't want me to get to Gambia bitamit and the role it played. Is that still a factor? Because you know when the Getabi was
aflatoxin, right?
Aflatoxin, right? So is that still prevalent? Has the quality of groundnuts gotten better? Because boy, you get chop Getabi. Left and right.
Yeah, so I'm not only get to sabun. I think that's you know, kind of like groundnut that is like moldy, you know, because you could store in a dry place, and you know, the fungus grows on that. So the aflatoxins that, you know, come out of that lulu, it's difficult to kill because lulu, it's resistant and it survives. You know, so the guy is there. You should I get you know, domada, you know, literally everything. So then you get so lol tamit it contributes, but it's second to hepatitis B. Hepatitis B is really the main push factor when it comes to, you know, chronic liver disease.
Is vaccination still available?
Yeah, available.
Publicly?
Yeah, publicly.
Adults?
Yeah, even for adults. I took mine about 4 weeks ago.
Okay.
It come doctor I have you can more be encouraged to particular healthcare workers. But people don't
because exposure.
Yeah, because exposure, but people don't opt for
But also people that have multiple sexual partners as well too.
Now that they're doing very well with regards to Halide, then they do at early at 13 years. When they have campaign, they go to the schools and then start to give.
So but my question is, what are some of the conditions that increase the risk of having cancer? So that
which type? Which type?
Been breast cancer, been prostate. Because you know, you have like over 100 types of cancers. So I want you to enlighten.
And maybe start with what's cancer. How do we describe what cancer is to a 5-year-old in Wolof, Mandinka, in English?
No,
because I think that's important. Then you do for breast cancer, right? But Louis cancer.
Cancer.
Explain that. See, the growth of abnormal cells. Yeah. But how will you say that?
How do you explain it? Then I could them with school 5-year-old bo hamne all of regular dega, Mandinka regular dega. Wala English rek like that. What's the simplest way to explain? Because some of them they want to legally in healthcare professionals. When they foreign factory niti medical terminology, then they rare. Can you do large? Right? So what is cancer?
Very.
Our mother, then I mean Dr. Jaiteh.
Man su ma ko bëggee wax ci olof dama ne cancer dafa nekk feebar boo xam ne sa soldaari yaram lu ñu wax cells.
Now, I saw that it's your immune system, your T cells, or your CD4, your immune system.
Because cells,
What's a block?
cells.
Yeah.
cells non blood bi
Give an
blood cell la
example,
wax
yeah.
dama ne su nekkee ne nit yaramam bi
yeah.
néeg la
donc bu la teg pression
cells
borom
mooy
cancer
block
bàyyi mu
No,
explain
cells
ni.
because of cells ñu ne cells is the building block of life right
Wow.
is the building block of life mais ma dama loolu mooy sa soldat yaram bi
waaye soo ne soldat that's the immune system that's a defense
daf lay
mechanism
dugal fii de.
waaye tamit cells yi lan la doon
loolu Omar loolu benn rek la sax white blood rek nga def léegi red blood cells yi
ma ne yow doo bàyyi borom si.
agsi nga.
mu explain.
mooy sa block si yaram yi
mooy sa
I don't want to go to that.
right mooy sa block si yaram
Right.
block sa yaram yi
man loolu laa wax
man ma ne soldat man daal ma ne soldat waaw ma ne soldat
loolu biology 101
waaw immune system keneen tamit mun na ko define lu ko ne si olof because olof time bi lañ nekk du use because of cells foog ma ne am na direct translation si wolof
Well, xaaral ma laaj la Omar.
Waaw.
comme ni ñu ngi wax cancer.
waaw
waaye ndax olof am na a word for
Bàyyi
cancer.
cancer.
cancer non amut
léegi ngaa dëgër fi di
Soose.
explain.
Soose. Cancer o.
I do my research before coming.
waaw léegi yow kon lay explain ay body cells.
ba xam nga
dama bëgg a waxal gars yi lan mooy cancer
nga ne amul léegi ngay explain.
olof bi
Waaw.
soo ne ko cancer dégg na ko
waaye
xam naa ne maybe suñu
man ni ka de use cancer
cancer dina am olof dina am si baatu olof.
Hani bi donc kam ko rek ni ya fo ñam hani bi mala memo.
cancer loolu laa la nekk di la waxal man léegi su nekkoon ne dama ko explain la nit ki olof bi su ma faana olof bi ma bëgg ko explain dama naa ko dafa nekk feebar boo xam ne sa soldat yi yaram yi lu ñu wax cells mooy sa soldat yi yaram yi yooyu lay attaque te su ko attaqué soo ko teelut a detect lu tubaab di wax métastasise su métastasise daf dee gros mooy daf dee spread lu spread mooy day màgg so su màggee am na place yu muy téye sa yaram bi si jigéen mun na téye sa ween bi am na place mun na téye sa liver bi mun na téye place mun na téye
yoo xam nga lan nga gis explain man autoimmune disease
auto-immune maa ngi defar cancer nga naan
man noonu laa ko understand
xaaral ma dimbale Omar. So, su fekkee ne loolu la jëlal exemple su néeg su fekkee ne yaa ngi sampa néeg looy use pour sampa néeg blocks so da ngaa gis yaram bi tamit noonu la mel
dafa am blocks
léegi
blocks noo ko waxee sa olof
foog naa blocks la
blocks la
ok kon daal yéen
but cells blocks la
daf la bëgg a dugal la bul nangu de.
no but I think blocks is the best way to describe it
pour nit yi mun a understand
understand, yeah.
waaw so da ngaa gis néeg bi soo nekkee si néeg bi yaa ngi am blocks ñu raax ko ñu plaster ko ñu paint ko nga gis ne daf dee uniform so yaram bi tamit noonu la mel dafa mel ni dafa am ay blocks mooy cells yi dañ ko raax ñu def ko si organs so da nga gis nga am heart the liver the breast and all that nga am bala nga am organs nga di nga am tissues yeah so da nga gis ne loolu cancer soo ko bëggee explain very easy simple terms da nga gis ne primary one students sax naka mën a understand mooy blocks yi so da ngaa gis ne yaram bi dafa am ay blocks waaye blocks yooyu noonu da ngaa gis ne dañ am lu ñu dee ooyee life span blocks yi dafa mel ni dañu am expiry date
dañ dee
dee so da ngaa gis ne cell yooyu noonu suñ dee new blocks ñoo dee ñëw ñu replace
kii mu ne la soldat.
am naa ne ma si yoon bi soriwut
soldat rek yaram bi.
so da ngaa gis loolu mooy normal bi suñu waxee ne xëy na maybe sa blocks yi dafa am expiry date of 90 days 90 days after 90 days dañuy expire yeneen blocks yi ñëw replace soo amee cancer da ngaa gis ne 90 days boobu noonu daf dee ñëw waaye cells yooyu ñu ngi bañ
ne duñ dee
da ngaa gis nañ fa dee nekk new blocks yu ñëw nag generate yokk si
ñu tegu si waat
Mu gën a group.
best definition
yeah so at the end of the day
donc
jox ko loxo
naa jëlaat beneen kaas
joxal ma ko
xam nga ni ko expliqué waaw xam nga lu may wax yéen man lan laa nekk di xalaat booy yàlla
yàlla du nit Ali Baba Kumba na.
non mooy chief non
mooy docteur bu mag bi.
Donc ndebe ñinen ka ni ba jam fa la ko den kam mul me ka fo ni microwave fo la ni electronic gadget tool aka cancer cause le wo mu to
non but lu mu explain bala ngaa dem ñanta woo fo man ka kan explainal ko lu mu ko describe
afone man ko yàlla ite sani la man ko man sene.
wada ken ma
Wala mo ya moy.
yo donc
sura muso sura wala tunda
donc fela en karande jam ako mena mo kantati aka kam tare bloko ni ka bungolo ako ya nan buloko mbe wala ni ka bungolo sula ta ka buloko la nyoka ako buloko ni la nyoka ikana le bungo nyera ni boto to e bungo ta ya pento baro buloko ni wucho la bala comme ko wato la bala wato mi anon ko nyanta faala le tul fane na nan ko te regenerate ako kantara karola o bulok folo mi anon ko bije wala ka balan comme e buka fana faala dal kata e ka je bulok dol fana bulok do fana kana ka kafa kan na ka janjang kata balo de la dol
so bayi lako wala tinna kansa jama taman serum minti wolen akake berolti na rasun jonyinde fekene wayn la def day nek donja parce que the excess cells you baña de ñoo de accumulate ñu def lump so cells yooyu dañ dee continue to grow cells yooyu dañ xaw a uti ak yeneen dafa mel ni moo tax ma ne Omar sa definition bi no it's not wrong it's not wrong
yaa ngi doon fen
jox ma ko soldat la bañu ma defet jox ma ko
waaw loolu la da ngaa gis ne dafa mel ni yaa ngi am ay soldat yi foog ñu jël order obey naka lañ ko dee waxee
obey and complete
yes obey and complain or comply
comply
so cancer cells ñoom ay rebel lañ because si yaram bi blocks yooyu normal blocks ñooñu dañ dee déglu wax so waxee ne da nga am 90 days after loolu da ngaa dee cells yi dañ dee obey cancer cells duñ dee obey ñoom kay rebels la so dafa mel ni soo amee ay soldats these are rebels ñoom kay ñu dee déglu kenn dañ dee def lu leen neex so da ngaa gis ne ñoom dañ dee continuer di multiply so yaram bi énergie bi lekka bi ngay jël cells yooyu noonu ñoo dee jël loolu yëpp moo tax da ngaa gis ne cancer su demee ba advanced stage yaram bi day dem parce que da ngaa gis ne nutrients yi fu ñu war a dem duñ dee mën a dem fu noonu because cancer cells ñu ngi lekk rek ñoo gën a am appetite ñoo dee gën a am doole so da ngaa xam nga rebels yi moom amuñ benn commande
te dañ dee tukki fu leen neex
waaw so da ngaa gis ne fu leen neex lañ dee dem so moo tax ma ne sa explanation bi
booy am nga passing grade
na pass kon pass
dama lay dégg tamit radiation exposure ñu ne daf dee joxe cancer also su ma dee seetaan xam nga man moom dama sopp woot dama dee dégg genetics mutations I don't know man xamal luy loolu ñu la def about genes
no I know so breast cancer especially maybe the HER2 new gene
so léeg-léeg ñu ne soo defee x-ray mu nga si jëlee cancer yii nii daf dee tax ñu bëri dañ dee ragal pour do some certain tests
bala nga teg laptop si sa lab si
so maybe
I'm not loolu yëpp it's missed so I pass a question bi it's very important in terms of lan moo dee cause cancer
risk factors and causes
so loolu it's a very good question mun naa wax ne we have answers we don't have answers am na yeneen cancers yi xam nañ duñ ko dee cause cancers like liver cancer loolu xam nañ we just spoke about it léegi nii aflatoxins hepatitis B hepatitis C so loolu they're due to infections mostly viral infections cervical cancer mooy number 1 cancer juróokaay bi I think that's the cervix right
yeah
so loolu it's like it's also caused by an infection and Omar was talking about it earlier on loolu it's HPV virus
it's a sexually transmitted virus
exactly so few of those cancers we know that infection moo ko dee cause why the majority of cancers betay xamuñ research is still ongoing so kenn du la mën a wax ne lii moo dee cause breast cancer lii moo dee cause prostate cancer we can't say that because when I guess somebody who has maybe exposure to radiation has cancer, somebody else has exposure to radiation does not have cancer. So then I guess it's a complicated mixture of environmental factors and genetic factors. You also build, your makeup genetically, whether you're predisposed or not. But when it comes to cancer, whether it's breast or prostate, then they risk factors. So risk factors more. Things that increase the likelihood for am cancer. So nekku ne so amee lii da nga am cancer forcé. Why? So ko amee war nga bàyyi xel because most likely you are at a higher risk of having that cancer. So different cancers have different risk factors. We're talking about breast cancer in October. Mun na sani tuuti kaddu si loolu. Nga gis ne generally ñun for the understanding of the general public, we divide it into two. What's called modifiable risk factors and non-modifiable risk factors. Lu tax ñu def loolu da ngaa gis ne there are things you can do something about.
Loolu
And there
jikko.
are things that you cannot do anything about. So things you cannot do anything about in terms of risk factors, do they get you all chances of getting breast cancer is the female sex.
Yeah.
So nekkee jigéen. Loolu automatically daf day increase a chance. Wax nañ ko fii góor tamit daf ko dee am. Why 99% of breast cancer patients are female. So being a female is something that mënuloo change. Although ñu ko try léegi nii de. To change sex and all that, but
Yàlla nga yeb.
even though dara
yeah. So by genetically, the makeup be you're female. It doesn't matter what you do.
Yeah.
You're a female, and you're at a higher chance of risk of getting breast cancer. And part of the reason is because females have a hormone that's called estrogen. Yeah, so the hormone they do have a bit of estrogen, little amounts, but women have most of the estrogen. And breast cancer, it's a hormone-driven cancer. So the fight breast cancer, we keep that in mind, and there are treatments that are meant to fight against the hormones to keep the cancer from coming up. Another thing is age. The breast cancer, the older you grow, the more your likelihood of getting breast cancer. Although now in Gambia, we're seeing young people. But I've seen a 19-year-old who had breast cancer.
Does family history plays a role?
It does. Lowly is another factor. And that's something you can't
That's
change.
non-modifiable.
Yeah,
Mun
you
loo
can't
ko
change
change.
that,
Genetic,
But we can't be rek.
Exactly. So a patient who has a lump, see lachebi, we look for these risk factors. We ask them in the families, anybody who has had breast cancer, for instance. And lolu munna nega yaibi, or sister or aunt or even grandmother. And for male cancers, family history is one of the reasons why males get it. So I guess su fekkee ne jigéen dafa am breast cancer, góor yi ñu nekk ci family war nañoo bàyyi xel because they are at an increased risk.
But how hard is that in society bi nga xam ne family duñ dee waxtaanee mbiri feebar.
No, yeah.
am na yenn families it's impossible ku dee dañ koo suul rek ñaanal ko. Nobody talks about cause of death.
No, it's very important.
dañ war a am log sax lu ma dee wax nit yi mooy utal catalogue family tree. am nga family tree.
No, fu ma koy jël.
am nga. You should. Anybody cause of death, you should document it. Nga baal ko the future generation. But families don't talk about cause of death. So how challenging is it when you go and try to get family history?
Again, it's cultural because I guess there's unfortunately, it's a mixture of culture and a little bit of a religion. It's more cultural than anything else. I guess today, we just want to hurry up and bury.
Yeah.
There are religious obligations and all that. Why? While you're trying to save other generations.
Yep.
So it's important. That information is not for the person who died, but it's for those they left behind and those coming.
Yep.
So that too is another, stumbling or barrier in trying to know, how your family history is. I have patients, I ask them, is anybody in your family who has had breast cancer? Either, no, we don't know, or maybe the mother or the aunt passed away, but nobody knows. And the next thing,
we're a conservative society, at least in the past. Before jigéen yi dañ were dressed modestly. Pour nga gis weeni jigéen is impossible. No, but it's true. So nekkee waramba suñ outfits yi. Mère bi mun naa am breast bi boo xam ne sa they've already removed her breast. Doo ko musa xam because hopefully kenn nekku di nampa at that stage bi léegi. Right? If you look at the age bracket, seen jëkkër more than likely dee na. Because if they have it in their 50s, seen jëkkër mu ngi leen magee 15 years, how many 70-year-old men are around to witness it?
Very good point.
Mus nga gis sa weeni ma. I mean, astaghfirullah. No, but lu ma mean rek in general, you don't see them. So mun naa nekk di feebar mu ngee kaalu mu ngee sol ay yére te fekk amatut ween.
Yeah, and diggante jigéen yi sax man I've actually had a patient who dafa amoon breast cancer. Unfortunately, mu ngi ko doon nuba. And later on it became so advanced. It got big and unfortunately got infected. So now I guess in the head be. Mortar. I guess the guy So and he was living in the same house with the daughter.
Oh man.
It's the stigma around it. I guess they're not sure how people are gonna accept them, react to that.
Yeah.
And Lulu, I've seen also men, married, and then eventually jigéen sa amee cancer or ñu dégg cancer.
ñu bàyyi ko.
That's the end of it.
I think Doc mu ngi wax lu important. I think also society has a role to play because the fear ak stigma bi ak misconception or understanding of the disease plays a very pivotal role. So léeg-léeg nga nekk si society bi sax nga ñëw di explainal Omar suma weeni maa fi yow soo xamee lu la dal.
am nga cancer.
Waaye xam nga waxoon na ne in the beginning ne góor yi we have a bigger role.
Of course.
And I think we need to sensitize the people about xam nga the cancer is a curable disease or manageable disease whatsoever. Dalal nit du jaaxle ñëw si yow di la dis problème nga ko en àdduna yow de soo xamee lu la daal.
waaye xam nga jikko bi lu docteur doon wax mooy su nekkutee cancer sax I believe ne gis nga Gambia suñ buggee change suñ health sector bi. It's just our attitude towards health care. Teel a dem teel a feeñ. Loolu ñun suñ generation suñ dooroon di ko jàngal xale yi at primary school dëkk bu mel ni Gambia we'll have the healthiest country in the world.
And góor yi sax dégg naa test
All of our problems. Man soo gisee every disease buñ dee wax cardiology, cancer, diabetes, hypertension, common theme.
Late presentation.
Late presentation.
beneen test boobu naka la tudda sax.
Testicular cancer.
waaw. boobu Doc.
xam nga lu ma dee moom gis nga góor yi ñu ne góor the only time they care about healthcare is when it comes to their sexual vitality. It's so wired in the psychology of men. Yen côté bi moom bu wàllum jigéen ñi weeni nampa bi I don't know what's happening on the right side. Right? Anything that affects te bés boobu maa leen doon laaj na yéen mus ngeen a dem defi physical ngeen dem docteur bi mu ne wàcceel tubéy ñu seet sa testicles.
loolu gars dañ ko dee téye di boxoñ xamal
But I asked him a simple question. When was the last time as a man somebody did a physical exam on your testicles? No, but musuta am. So yow soo dooree ba sa testicle bi am ni sukur bi nga dem di expect miracle. No, loolu la dee happen bi. So yow doo ko dee defal sa bopp.
Non dama ko dee defal sama bopp.
Left winger bi ak right winger bi.
Sometimes mu réer nag.
waaw léeg-léeg daf dee tamit balance. waaye loolu is normal de Doc comme nga eew léeg-léeg affaire si du balance.
wala mu réer.
am na tuuti difference now.
Sometimes benn bi daf dee xala réer.
Yeah, I mean.
non daf dee mën a dugg si.
daf dee réer Pape.
loolu sax si jigéen ñi sax dañ ko dee explain in terms of breast cancer. benn moo gën a one is a little bit bigger than the other. Yeah, so loolu si testicles yi tamit it's the same thing. Yeah.
maa ngi xam nga suñ di soo dee liggéey si lopitaan bi lu nekk koto bi dafa eew rek jaaxle ne bro affaire si dafa sutante ma ko no is normal so moom mu ngi jaaxle mu ngi war a ñëw
waaw yow waruloo ko wane is normal de yow doo docteur yi
kuy ñëw taka jabar next week dama affaire saa nga lifi ma ne ko déet man yi fi xaw ma si dara waaye daa naa ne daa is normal
déedéet bul dee joxe advice de man daal ku ma laaj léegi one answer laa lay wax dama gisi docteur dama gisi docteur
waaw donc loolu is normal
te bul dem Google
loolu moom is fine.
ba pare bul dem Google wala nga dem chat GPT nga ne ko I have a lump in my breast mu jox la directly.
And the funny thing is you go with chat GPT and AI the guy is they can give you wrong diagnosis.
Yes,
So they hallucinate. I mean that's the term.
Yes.
So it can hallucinate. So you're like okay I got the answer.
Yep.
Yes, I didn't patients and then they tell you information they got from Google and they believe in it unfortunately. So from you buy healthy information there's a lot of misinformation out there as well.
Yes. Especially cancer. So obviously we talked about the non-modifiable. Yooyu moom mënuloo koo change. What are some of the things that you could modify that are linked to jikonit behavior? Because I think ñun society bi loolu moom lu la yàlla may loolu la yàlla may. But there's certain things and there are many lifestyle choices, modifiable factors. So just touch on that a little bit.
Yeah, so I guess one of the reasons why we're having so many cancers now compared to maybe a century ago, so in lifestyle bit of a change.
Yep.
Completely, yeah. I guess we live in an era of technology and ease. Time over I'm not soon mommy soon them from here to Basse maybe how many days 3-4 days or even a week. Them Maka, you had to take months, I mean, or weeks at least, journey, trying to get there. why with that technology comes the downside. And ñun as, people, we've stopped moving around.
Yeah.
Nga duga taxi or van or sa auto. Nga dawal be office bi, nga toog sa office bi, liggéey, nga pare, nga wàcca, duga auto, dem si kër, toog, seetaan télé. So you're basically sitting.
Naan ataaya pap ak 5 kaasi sukur.
Exactly.
Yeah.
So basically, I guess we have a sedentary lifestyle.
Yeah.
Lolo muñ dinde yegent. Our grandparents were, working in the fields, they were doing physical activity. They don't exercise. It's part of, exactly. They don't, they used to walk long distances and things. We don't do that anymore. So our system is not able to build that resilience that is needed. Because I think the immune system, it builds up when you're physically active.
Yep.
It builds up when you're able, and when you're physically active, you tend to have better sleep. Ñun tamit with our daily hustle, ñu ngi stress, we're thinking of stuff. So
Landlord bi.
Man kay landlord bi sonal na ma.
yombut.
Léeg-léeg nga eew gis 5 missed call ma ne ko sëñ Daara.
Waaye mbaa nekk di la charge in dollars.
Dollars daf ko ñemi. Migrate de.
Yeah, so the guys say student lifestyle is really affecting us. We're not exercising regularly.
Yeah.
We're not getting enough quality sleep because it's during your sleep that your immune system actually helps, builds up and, strengthened.
Yeah.
And cancer is something that we all have cells, rebels in us.
Yep.
And I guess that kuneka, you have cells that go haywire, cells that disobey. But I guess soon yaram bidafam isolda come on go ahead, that are able to fight against that. And they can only do that to the immune system is good. So you need to get sound sleep.
Yeah.
When you oversleep, like why?
No, his sleep is his medicine.
Yeah.
That's why your immune system is good though.
It is.
Yeah. So
Perfect example. Man I'm struggling with.
Because
with sleep.
Doy na la.
No, nekkul duma dee nelaw. I think liggéey bi.
But he works at night.
Man duma dee nelaw.
No, why night shift? It throws your circadian rhythm off. We're not wired to be working at night.
Nekkul na comme ma tëddee duma nelaw dinaa nelaw de waaye liggéey
Man
bi.
even su ma nekkutee night shift sax pour man nelaw problème la because maa ngi miin ñaaka nelaw bi.
Loo dee xalaat.
Yaa ngi ko miin rek nekk night all the time.
Working night shift.
Soo nekkutee night shift sax pour nga jël nelaw daf dee nekk yebal.
Yeah, but night shifts, again, not to scare anybody, it's associated with a slightly higher risk of chronic disease.
Yes. Yeah. No, dégg la.
So dafa baax nga change shift. No, I'm not.
mu ne bëggut la ragal loo nit yi. Waaye liggéeykat yi guddi yi. You have a slightly higher risk of chronic disease. No, suñu yaram yi design nañ ko loolu.
yaa ngi xool 12 hours dangaa lekk toog doo dem fenn boo wàccee looy xalaat njëkk a xalaat moo nekk dem tëdda nelaw bala nga eewu fekk 2-3 jot na nga paag waa di dem
ba pare yàlla dafa jëkkaat naaj bi pour suñu yaram bi.
Man bàyyi na.
Right?
No, when you're defined, for change, get up morning, time to time, yeah, because then it's all like night shift time.
Especially healthcare workers. Yeah. Those are the sacrifices we make.
Yeah, unfortunately, yeah.
So sleep, sedentary lifestyle, exercise. You got to be. Is it a misconception that jigéen góor yaa gën a exercise jigéen?
No, that's the reality even.
How about Gambia?
Yeah.
I mean, if you wake up at 6-7 in the morning, so let me see Manchester Kunda.
Exactly.
Go to air.
That's a misconception.
Yo, exercise. Who
are the laziest? Because it's easy when you exercise them gym.
Wow.
In terms of total steps and calories on average. Jigéen yaa gën a yëngatu.
ñoo ñu doon njëkk a eewu sax
No, Gambia soo bëggee xam ñu ne liggéey dëkk bi comme noo ko waxee 5 a.m.
suñ maire fajar
man du maire rek sax
jigéen yi sax
naturel de ñoo ñu doon njëkk a eewu
nawet bi sax demal si faro yi fu mu nekk de especially up country booy yëpp nekkuñ fa. So it's just jigéen.
booy moom ñun bu ñu amutee liggéey moom ñu ngi tëdd de
ñu ngi over tëdd sax.
Non, boy.
Boy du ne teel a jóg.
boo nekkutee dem job amuloo job
over jóg fajar yi dem dóori waar bàyyi loolu boy bàkkee moo boy.
Pour liggéey.
boo
Waa ñu amul liggéey
laa wax de boo demutee liggéey laa la wax de booy dañoo nelaw xam nga jigéen moo dafaa jóg obviously dafaa jóg
jigéen yaa daaxa nelaw jigéen yaa nelaw bi ba 10 o'clock di eewu
déedéet waaye on average
on average sax they sleep more than men do
suñu women yaa gën a productive góor yi
booy
boy
tamit dañ day eewu fajari dóori waar waaye ca doo continuer
waaye benn
boy boo moom doo mën a convince boy
I'm not a jurist allowed on that. So, I guess, it's all interrelated.
Yeah.
Obesity is something that also very big risk factor because obesity, whether in males or females, I guess the fat cells, tend to produce estrogen. So low estrogen production, breast cancer is a hormone-dependent cancer. So I guess low they're gonna increase risks.
Even some heart
breast
disease.
cancers. Yeah, exactly. It increases heart diseases as well. So, you can do something about it. You're obese, get physically active. Right. Whether it's a gym or the beach, just make sure you're moving around.
Yeah.
Get anywhere between 15 to 45 minutes a day of work.
Yeah.
Whether that's jogging or whatever. Lulu, it'll help keep you, in shape and have a healthy weight. There are a few things, Tamit, that can help reduce your chances of getting breast cancer. So, and one of that is Tena Amdom.
Oh wow.
Yeah.
Oh wow. Xam nga we had a
I'm gonna say why don't more gonna am solo. I'm not in Lulu is a bit controversial.
No, but it's true though.
moo tax suñ maam yi suñ lifestyle
doka baraka fere ya fele na fo gaade jande ngoy ko literature ka fo modena jama ni mam futu juna wala ma wulu juna after the age of 28 most of these problems come.
But okay, man sort of though. Futu, how could you futu
No,
yourself?
hormone thing may was something very important.
No, but it's true. But why the reality of Gambia is true, most men, women are not getting married early.
Why?
I agree.
Jigéen mun na taka boppam.
xanaa góor yi du ñoo ñuy daaxe.
They did. There are more women that are available for marriage than men are.
nekk jël foo rek.
Bismillah. Right? But being early, that's very important. Pour nit yi mën a xam ne teel a am doom.
Yeah, so that protects. ñaareel bi tamit soo amee doom nampal.
Yeah, nampal.
Yeah. So
Really? Okay.
Yeah, so it helps the child, but it also helps the mother. It protects the mother.
nampal bu doy.
Wow, bu doy, exactly.
ñu ne léegi-léegi suñu askan bi dañ dee teel a feral xale yi.
What's the average age?
Formula.
2 years max. I think.
Yeah.
Two
years. Jigéen ñu bari léegi duñ leen
nampal at least 2 years.
That's the WHO recommendation. More recommendation.
recommendation mooy 2 years.
Yeah.
1 year.
But how could we make it realistic? ñaata liggéeykaay ñoo laa jox 2 years pour nga nekk di nampal
waaye
si
loolu tax warut a tax doon nampal guddi.
boo wàccee nga nampal.
soo na ay tax nga nampal guddi di nampal bëccëg. kay mën ngaa nampal liir bi.
But lu ma mean mooy we also labor practices. It makes it very difficult. Xam nga yéen ñi Gambia they have 6 months of maternity leave. Xam nga America ñaata la lay jox? 6 weeks.
6 weeks.
1 month, 2 weeks.
6 weeks maternity leave. Moo tax yéen diaspora bi xam leen nekk di dundal si diaspora bi. Xalaatal nga jur doom 6 su yàggee ba yàgga 10 or 12 weeks.
That's
You
2 months, 2 weeks.
6 weeks nekkul 2 months sax.
They calculate.
And you are back
Postpartum
to
period, we
work.
calculate no, exactly.
Right?
Postpartum period.
Gambia 6 months. We mama ñip say I was like, today is my talent. First of all, I was like 6 months is long, right? No, but all these things, soon life gets in the way.
Yeah.
Career, professional career. Sometimes it could be correlated to don't tell am doom.
waaye xam nga am doom tamit du nampal bi rek after coono bi dog day métti.
No, but there's factors in our lives. ñun suñ generation, professional pursuits, lack of available men as marriage suitors, right? Góor yi tamit ku nekk a ngi am si benn. So even such chances, if you are ranked desirable or yàlla may la wërsëg, léegi average what, 27, 28? That's when most of our sisters are starting their pregnancy journey. Te am na ñeneen ñoo xam ne ñu ngi dugg seen 30 close to 40. Bala ñoo am a perfect suitor because in society we shame women who have children out of wedlock because suñ diine bi santaane ko noonu and it's good for society.
So in short we can like get up to 2, 3 to stop that.
Xam
to
nga
minimize it.
xam nga
man moom suma wax moom
xam nga façon yi man ñu dee wax yow yaa ngi just takka jabar amaguloo 1 year sax.
kan ma waxuma man de bu ma dugal man men laa wax in general.
Danga volontaire.
Sëñ Daara mu ngi fi di. Sëñ Daara sëñ Daara amaangut na jël bien.
Don't bite more than what you could chew. Right? But okay, so definitely having children early.
Yeah. So that definitely protects, gives a level of protection when it comes to, breast cancer. So those are things that you can do something about. You can decide. Obviously, there are, certain things you need to consider. Why, if you can, it's better to marry within a reasonable age, and then try and get a child, at a fairly early age, before your 30s. So it only protects you, in a way against breast cancer.
Any correlations with cervical cancer with age?
Each year.
Yeah. Cervical cancer also.
If it's in terms of, childbearing.
Not necessarily.
Okay.
Cervical cancer, again, we said it's infection based.
Yeah.
So Lulu, it's based on the number of partners and how early, the sexual encounter. Sexual
And that's what I meant in terms of if you take an average woman who, let's say, has had multiple sexual partners, but really hasn't started having a child until their mid-30s. Or even, right? Obviously, that means that there's multiple risk layers because they're not attached to only one sexual partner. So there's a level of exposure as well. And I know the HPV vaccine is available now, but the uptake, is it commercially available? Is it available at our public institutions? Because it seems like also that puts our sisters at a disadvantage just in general. Starting life late puts them at a disadvantage.
Sure. And you talked about vaccines. We talked about hepatitis B vaccines, Lulu, since childhood, children, it's within our vaccination calendar.
Yeah.
For HPV, it's younger girls. I think they start about 9 and then another shot at 13.
Yeah.
It's been introduced in the Gambia for several years now. Why problem it just comes back to the same thing. Lack of awareness and how people are not accepting to get their children vaccinated.
Really?
So a lot of myths. They're going to be sterile. We're injecting them with things.
Family planning.
Family planning and things like
Oh, wow.
that. So,
Okay.
Lulu, it's a big stumbling block. And again, it's awareness creation. This vaccination is just like any other vaccination. It's just to protect them. So again, we have a lot of barriers.
And it's available free of charge.
Yeah.
Is the particular harm
I know when it came out, it was Gardasil in the USA, and we did have a problem in the USA because we were vaccinating it a lot at community pharmacies when it just came out because insurance won't on cover. But Gambia part of it too, like the vaccine, I know Gambia has a really good record when it comes to vaccinations. But in things like this, is there an opportunity for it to be both attacked from private and public sector and made a part of primary care? Because it should be.
And also sensitization.
Because tetanus, you're supposed to take the Tdap every 10 years, then what you'll boost the shot anyways. Right?
Yeah, sure. And I think soon problem you buddy, it's related again to sensitization and awareness. But apart from the public or government, there are private or let me say other stakeholders that are multinational. Have the Gavi, the Vaccination Alliance that can actually who also help in providing shots. For availability to countries like Gambia in order to be able to achieve their targets. Why the family vaccines, but people are hesitant. You can't force them.
Yeah, we saw it during COVID.
Exactly. So again, sensitization it's really, really important.
Yeah.
People need to understand, what the vaccine is and why they're being vaccinated.
Yes.
So Lulu, and I think this comes down to health promotion and sensitization, both from the public and the private sector.
And the men taking the charge. Because I'm got a lot of decisions. We have to be more active. Because so I'm a dombu jigen. I'm in the society, new body dynamic kirby. Jabar bi du muna enu dombi. Yobu ko jox ko vaccine bo xamne papa bi understand the reason if the misconception is li miri family planning la. Wa yow mu nek papa so amé dom bu jigen nga collect sa dom bu jigen yep wax ne li dégg na ne li mu ngi am vaccine bi mun na protect pour nga am cancer in the future. Xam nga de papa bi su waxtane yaay bi. Lolu is a easier decision making than yaay bi wara yobu then nit wax ne sa dom bi de yobu nañ ko. Right? Men need to know about these things and families it'll be mandatory once-a-month meeting in every family household about healthcare. The culture, it has to be part of it.
e ba ma dar ma taraja ka fa ko fa ma man taraja
Papa
you have to talk to the father
Of course.
or you have to come back but comme ndaka min fo mole rek we all have a family nim ka fenne di mola mi yalan ka ambete ya di ba di kan no mola or whatever so fenne mi yalan ko aka jibe kende ke dan di ba di da dinno la pour ka mol tag docteur ya faja ko mayata ba ka ñinu mo courant la di mi yalan ko na da fa wajabita abuka jabi no jarano anda diminta ba ka very difficult.
And it's free. The vaccination is free. Mananga Gambia, the frustration I have sometimes with Gambia is we underestimate how many healthcare services are close to nothing. Gambia, kuneka Gambian, bilai danga am worsak when it comes to healthcare. I know people do not understand Lolo. HIV. Gambia is one of the few countries where everything about HIV care is free of charge. Right? Because swing population been fund down. So anybody then they complain that our health system, the X, Y, and Z, but it's actually an advantage in some aspects, Punganeka Gambian in terms of access to healthcare. And this is a prime example. We talked about cervical cancer, vaccine base available in private centers, age bracket bimungfa, access is there. People are just not seeking it as well too.
Giving out head.
But this one on the right side, Mom.
Does it contribute giving out
So he was talking about, the sexual risk. Oral sex as it relates to cervical. Obviously, HPV, there's a risk.
I'm going to dig into society. When they give out head, the risk of the chances of you having cancer is very high. So I don't know how true it is that.
Yeah, so HPV is actually is an infection. So infection bobunono, it can go to the throat, and it can give you throat cancer.
So if you bend down there's a high chances of you having throat cancer.
There's a possibility.
There's a possibility.
There's a possibility.
I'm gonna addend it. I'm gonna yalla bum ko bindé. Xam nga lu gëna or. Same sex partner, right? Nga MC. Yeen ñaar ngeen xamanté.
Definitely.
Lolu is the biggest modifying factor. Lo mëna control. Góor yu bari that's the best risk is abstinence su nekké amuloo jabar.
Xam nga ñene dem san partner tam maybe loolu mo ko dé jox bané. So mo tam nekk di nit yu bari society bi seen jigéen ñi dañ ko dee demand from góor.
Waaye Pape te du yow sëy nga.
Waaw.
Hopefully bala ngaa sëy sa jabar noos la. So I know ne yéen seen mbiri wërgu yaram waxtaan dafa am. Right? Xam nga fu mu toll. Moom xam na foo toll. As long as yow génnuloo. Right?
Waaw. Léegi ñeneen ñu xamul nag bugg a joxe xeet.
ñu dem find out.
Waaw moo tax may find out from doc now.
Right? Yow ñaata yoon nga when you're single mus ngaa laaj jigéen ndax mus ngaa am HPV vaccine. Mus nga koo laaj kañ nga last def STD test. And this is a responsibility thing. How many men, before they engage in sexual relations, obviously, it's a sin, but Gambia len deka. What is in Kote? Dama de wane dega la ñun lu ñuy wax.
Te gaay duñ dé bëgg wax bo.
Xam nga loolu.
Dañ dé wax nit ñi lu di dina bi dina waaye bu gaay duñ
wala sa xam nañ dem suñ culture. Some people may not have sexual intercourse to protect their virginity because that's the only important thing for whatever reason. Where say it's important, but not for the man. But oral sex is like the bypass, right? So it could be frequent. It's the same level of exposure without realizing that the risk of HPV, the risk of is still there. So I think it's important that we talk about.
Yeah, Kamnoko is an infection. Infection within the sexual organs. Because there's a lot of cancers of the throat. That happen. And a lot of them are actually due to HPV. Okay, so why anybody who's exposed to that would have.
But HPV is also very difficult to know who has it.
That's why you shouldn't even take the risks.
No, HPV is quite. It's all over. HPV, is an infection that is all over. Why what determines somebody getting cancer or not? It's your predisposition. Understand? Some people are more likely to get cancer or develop cancer than others. same exposure to the risk factors or the causative agent when it comes to HPV, but one person has it, the other
And one
doesn't.
person has.
Yeah. So the best thing is doctor go ahead, right? Abstinence.
Abstain.
Yeah. So
Be like 30-year-old virgin.
Experience.
He's the only 30-year-old virgin I know in Gambia. It's non-verifiable.
Friday may celebrate 31.
31 Friday bi sa birthday Friday la
Man Saturday.
Friday mo
happy birthday yéen ñaar next day
Third fourth. Man 10.
campé bi birthday boys yaa ngi nii
13 October.
waaye dañoo def
Boy dafa
condition
mel ne campé bi yëpp
déedéet xaaral Omar bu fi celebrate 32 te amuloo jabar possible ut sax
waaye Omar hangal ko li fi 23 years bi la.
déedéet
Stop ki mu ngi build benn relation.
waaye ñu ngi doon wax mbiri suñ
That's
sister si xam nga luy problème bi we have a lot of 32-year-old men ñoo xam ne mut nañ takka jabar ñu ngi
Omar
caaxaan
mu ngi laajte gaay.
déedéet
Omar yow
kéemoo sax mu ngi noobi kéemoo tamit waatoo siitale de kéemoo defa nañ
non dañ dog ba kajaar.
No,
ko jëdé ma kajaar.
so leen dalawee fii ba ma takka ñaareel fii te takkaangul.
ñaareel la.
Ara ma wax ndànk sama.
Yow ñu laa dégg.
waaye xam nga li ñu wax xale nga puusal ndànka puusal ndànka man li ma wax mooy sa sister waaye fi ñun endorsuñ de toppatoolagum sa benn
Maangum si benn.
ñu ne yàlla du la tegloo antalo tëdd
waxtaan mi neex ma lifin su ma demee kër war a expliquer.
nga fanaan si couch bi
maa si benn bi.
li nga xam right so going back to obviously the modifiable factors we talked about the risk as well.
So other things, and when you look at cancer in general, because he asked a question, Mom, he's like, what causes cancer? All cancers.
Yeah.
You know, obviously there's specific risk factors in certain cancers. Why like they can cause cancer in different organs. And hidden maybe li bari would susunjigeni why smoking is another risk factor.
Yeah.
If it's not for breast cancer, it can cause other cancers, lung cancer, bladder cancer, throat cancer. So all these are cancers that can be caused by smoking. Fortunately, Gambia fini jigeni mude to bari window.
What do you consider as to cigarette or shisha?
Yeah, I was gonna.
Because hale yangi to shisha and vaping there. No, because it's funny. Swing here is two. New swing generation we used to think cigarettes.
Yeah.
But now part of social culture
Just smoking.
is shisha, vaping, and all of these things. They have like all kind of chemicals as well too. So
Definitely.
that risk is still very much there.
It's still there, and I think it's good that you qualified that because smoking is the traditional cigarette that we think about. Another thing that is a modifiable risk factor is alcohol.
Alcohol intake.
Yeah, glutamate, it increases your chances of not just breast cancer, but most of the cancers. Liver cancer, throat cancer. Alcohol is a very, very big risk factor when it comes to that. So all these modifiable risk factors you can do something about. And you can help reduce your chances of getting breast cancer.
Would you consider early detection or early screening as one of the most significant modifiable factors in terms of behavior, health-seeking behavior?
Yeah.
Man can bala Dr. Jaiteh Munyo. I think he's one of the most
Jaiteh,
powerful.
Dr. Jaiteh.
Dr. Jaiteh, rather. I think more gonna powerful more than everything. But I'm not need ko hamantene amon na ko breast cancer. Mom si bopam moko detect proactive dem MRC guy def investigation they find it out. Jappale nañ ko jigéen and then mu am 8 tukki dem surgery bi ñëwaat.
Dafa def complete mastectomy.
Wow, dafa completely mu ñëwaat. Now bu ko hoté you will never know. So imagine kooku bu nekkee ne detected ko early on. What would have been the problem and so many things. A younger girl.
So maybe Doug dinga laal to the process be, right? What happens in terms of how do you detect it? Obviously, there's a biopsy process oftentimes. The treatment, but also even the stages, because also, once again, because we correlate then therefore cancer equals death, that's because most of the times cancer detection happens at the late stage. There's metastasis as well too. And then there's challenges in terms of, therapeutic agents, in terms of cancer medications, treatment options, and things of that nature. So let's go through the patient journey in terms of, let's say, and we're going to use breast cancer, for example, because we're in October. Life cycle, obviously, things that are routine, like that you should be doing. The moment you find out what's the life journey of a patient.
Yeah. So,
and make it as very Gambia specific as possible.
Yeah. So breast cancer coming in October and even outside October, then they encourage breast self-examination. For the Omar Lana Situti, that is, trying to examine the breast. So pangalal wendi, and this is all women, from 18 all the way up.
Okay.
And the reason why I say 18, it has to be a habit.
Yeah.
Comme ni wan nga ham lusan normal. Mun nga am nyari jigen. One person has what we call a lumpy breast. Not that I'm not lumpy, why the textures are different. So your funga ham's a natural texture. So when you don't have any symptoms or complaints, that's when you start, eventually examining your breasts. Gaham li moist mo normal. So anything that comes up, and usually then they advise women, those who are seeing their menses, they wait for about a week after to have the hormone levels go down.
Okay.
And then eventually start, examining themselves.
Okay. Yeah.
So
week after same period, Bill, they advise again go out of self-examination. Right?
Yeah. So because obviously during the period it's a little bit more sensitive and you can have what feels like lumps, but they're not actually lumps.
They're tender.
Yeah, exactly. They're tender. So they need to know what the normal is. So whenever you see your period a week after, examine some way. So if there's anything that's even the slightest difference, then go detect. And that's the stage we want to be able to catch our patients.
Yeah.
And
the soonest you find out a lump. That's the best. Okay.
The best time.
Okay.
So, if you find a lump, lolu, it doesn't mean it's cancer straight away.
Yeah.
So what don't sit at home and say that, man mom, I'm not going to go to the hospital. Because chances are it might not be cancer. But you don't want to ham lolu.
Unless you go.
Exactly. So lolu, once you detect that this is abnormal, so when they come to the hospital, we do what's called a clinical breast examination. So then they do a breast self-examination. When they come to us, we do a clinical one, meaning that we do one within the hospital setting. And, most doctors and nurses have been trained to be able to examine the breast and then be able to tell the lumpini, is it suspicious or not suspicious?
Okay.
Yeah, so you would examine, look at the lump. Is it mobile or is it a lump that's actually fixed? Do the edges feel rough or is it smooth? Smoother edges are more benign, not likely to be cancer. If it's a bit rough, it's likely to be cancer. But again, this is not 100% because you can still have smooth lumps, but they turn out to be cancer.
Okay.
So the first step when you come to the hospital is do a clinical breast examination.
And that's when you guys do a family history as well?
Yeah,
at that time?
Exactly. So even before the examination, you want to ask those questions and, make sure that they don't have any risk factors. But if they do have risk factors, you're more alert and know that, okay, I need to go further and make sure that I rule this out. And the second step would be to do an ultrasound. So we do an ultrasound scan of both breasts, just to make sure, even if you feel there's a lump here, we'll still do an ultrasound on the other side just to make sure that, there's nothing that, we're missing out on. And ultrasound would tell you that this lump looks suspicious, but then that's about a 60 to 70% certainty. So you're still not sure that is breast cancer or not. Diagnosing breast cancer is not just a doctor examining you with breast cancer.
It's a process.
Unless it's a very late stage, because late stage signs and symptoms that tell you that this is almost breast cancer, but you still have to confirm it. But early stage, you do your examination by the doctor, you do your ultrasound. For women who are above 40, when they do mammogram. So mammogram is X-ray of the breast. We don't do mammograms for younger girls, and this is an important concept because the younger ones tend to have denser breast, breast tissue. Older women have more fat. There's a difference in the breast of a younger girl and an older female because the composition is different.
And that's not the reason why men should chase young girls either.
Pap yow loo may xoole Pap yow nga gas rek nga xool ma nii Pap yow lan la ay Pap yow tamit
very important academic foten wato kata la milk production ni bachikan for fat like a tele for rat na kaje akaboy bare doke ku point do fajang mi anaka kumada wala wadi ni wada ikifan jibe no ako jama ni ra kuroje lo kon killing after ra kuroje what more is the best time pour ke fan jibe ko katun ko ni bera kuro jega o katara isunjul ba bambanding so ni ama wato do je sanira bero je wato beroti but after dog ni nkala ku kidena other than beroni the time step do je mi ananko asa tandira no ko maybe you have a chance to breast cancer like will there be any changes in the nipple or in the areola
So mostly niajibe in breast cancer, munan be beronyo fokang is one of the most common signs and symptoms. But beroda mante, ika signs and symptoms dolje. It's in relation to lumping. So for instance, it's like a nipple ning. It's retracted. Akamda sunjunoing. And the reason for that is the lump pulls back on the nipples because there's connective tissue that's within the breast. So whenever there's a lump that's not normal, it changes the architecture of the breast. So that causes changes and distortions. And it's not the small variations. This is a big difference, in one breast compared to the other. It becomes red or the color changes. That too can be a sign that this is breast cancer. Actually, one of the most aggressive forms of breast cancer called inflammatory breast cancer, wobukake beroti, wobukake sunjole ka yiti, and
so there's discoloration, color bit of change.
If they have a honha, it becomes a bit reddish, So lul time it's a sign that there's something going on. So all these are signs. And another thing, so clinic, when we do our examination, then they hold the pochatani, So because breast cancer, the first place sujogesi when before them So lul time it's something that we look at. Just to make sure that this might not be breast cancer.
Does it come with pain?
Yeah. In some burning sensation.
Good point. Breast cancer is painless.
It's painless.
It's painless.
And that's why it's
So
and there's no impetus. I'm going to swim mate them.
Yeah. So at the beginning, then I guess they do they mate.
Yeah.
Yeah. And Lolo is one of the reasons why I need to do them.
Yeah.
So
they have
because already made they am some burning sensation.
time
they door the am two man that am breast cancer or not.
And it's not related to mate.
Exactly.
Yeah. So what the best thing in that situation, most of the times, if the breast is paining, it's not necessarily breast cancer. Why dok munaham lulu? And because it's painless, I can tell you for a fact, breast cancer in advanced stages, it's really, really painful.
Yeah.
Because the system be to an extent that you can't fight it anymore. So the mated be is so intense, you have to give morphine. To be able to calm the pain. So again, early detection, early presentation is really the key forward. So just coming back to how we diagnose. So mammogram, in women who are older, because they have less dense breasts. So I guess it's easier. So a cancer would show up on a mammogram.
Yeah.
So jigeni, less than 40, we tend to do an ultrasound.
Okay.
Sometimes you can have a combination of both ultrasound and mammo.
Okay.
Just putting a confirm whether this is breast cancer or not. Why the final stage of diagnosis, histopathology.
Yeah.
So lolu, the family the bena pengu bundau, ñu dugal ko ci donjabi, and then we aspirate some cells out of it. You hold it in microscope. It sounds a bit painful. Why? It's just a small needle. But the reason why we go through all this process because cancer, Lord, is a big responsibility.
Yes.
And you have to make sure.
And I was going to come to that in terms of the psychological safety of a patient, and even including this time, let's assume it's a woman and the husband. I want to keep bringing the men into the picture. How do you manage a female's psychological safety throughout the entire process?
Breast cancer is, for some patients, it's more of a psychological warfare than it is physical. Because just looking at her on the outside, what distinguishes her from men?
Breast.
One of the most important symbols of femininity is breast.
Huh? góor taxaw jigéen taxaw yow sa brain bi lan mooy first thing la dee ràññeloo
Anatomically.
Okay, look into it.
Yeah. So again, the breast psychologically for women, Lulu, it shows that she's female.
yes she's female
So imagine nga wara distort Lulu wala nga gene ko completely. Psychologically, that's traumatizing.
yeah.
You know, I'll just go ahead a bit and say that breast cancer treatment has advanced so much
Yeah.
that munga def operation nga gene wenbi, and then you can put another reconstruction.
yeah
You know, you can
Implant it.
reconstruct the breast.
Yeah.
You know,
Nga defal beneen.
yeah. Du nekk exactly comme ni original bi de waaye.
waaw na fa nekk rek.
Waaw na exactly.
original bi benn la yàlla defal de
Waaye boobu na fa nekk rek dox.
so yow pour yow you cannot be with a woman
Without la.
déedéet man kay ma laaj
De moom bu ma dugal di.
ma laa laaj bi
Mënu maa nekk jigéen.
wedding vows dafa ne till death do us part def for sicker or for poor
ndax yàlla tere su amee moom foog nga manage. Loolu moom features la rek.
nga manage. Manage nga
moom
wax.
looy def. Looy def.
Xam nga I think ne jigéen yi bari tamit dañ dee ragal ne xëj na seen jëkkër li leen
what am I laajte question bi I'm asking a question xam nga sama laaj Pap from beginning of episode yaa ngi emphasize nampa
askan bi laa fi toogal waaye
Dama la ne-
tamit jigéen tamit baakee ma waruloo ko bugg a ngir wendi.
déedéet waaye dama
xam
ne
nga dog laajte na loo dee njëkkaat xool
Déedéet mu ne lu dee wane.
dama xam na sa taari jigéen
waaw
ndax dina dëgër
Waaw.
wala gën a yokku sax su ko yàlla joxee fitna boo xam ne xëy na mun nga ko successfully treat
Waaw.
what would you choose ndax yow di nga change si jigéen boobu
non du ma change dog.
wala waxtu boobu ngay jóg dem takka ñaara
non du ma change dama koo taxaw dog. ñun
Ok.
Gambien yee.
yeah man loolu laa nekk di laajte ne
features yi tamit dañ dee contribute Omar xam na si dara.
because moom mi ngi laa wane psychology
Where do I pap? Why it's easier said than done.
I'll explain it.
ñun luñ dee gis sa lopitaan bi most of the time yaa ngi gisee góor su feebaree jigéen mu ngi fa de
waaw dog ko
Yep.
ñoo gore wuñ nag dog.
waaye da ngaa gis ne jigéen su feebaree
waaw
bi dafa def yàpp
benn la de
dëgg
Thank you moo tax may laajte we have to be honest as our brothers
dog su dee man la xaw ma kande waaye su dee man la man I'll stick with that.
kii mu ne la xam nga yow looy wax practical theoretic
No, even su nekkee reality.
the reality
Xam nga
is
lu tax?
kii lu may wax mooy there's a common trend
Yeah.
when men are sick seen àndandoor jigéen ñi dañ leen dee taxawaalu for
Yeah.
thick and thin
Waaw.
waaye suñ sister si suñ yaay yi suñ anti yi suñ doori di feebar
Waaw.
góor yi joxe
waaye
gannaaw
loolu dafa fekk ne tamit fekk ne jigéen bi da nga ko takka because of features. Because man lu ma believe mooy baakee man su ma taanee suma jabar si askan bi. Doo features contribute góor bu nekk bugg naa xam nga rek trapezium shape bi. wala Coca-Cola bi ak heavy boobs whatsoever.
Why we need
all
to
have different ways
we
of-
need to stop saying that because that's not a standard of
No,
beauty.
but we all have different ways of.
Yeah, okay, waxal loolu bul ne Coca-Cola.
waaw
No,
dama
no, get it.
nekk di comme faram fàccee rek. because tey yow noo dee buggee ak man nu ma dee buggee.
waaye mun ngaa
could be
describe sa
different.
spec.
Yeah,
waaye
but
dama
that's
ne
right.
jigéen bu nekk góor bu nekk ak yaa beauty is in the eye of the beholder.
Thank you very much. Loolu tax ma ne la-
But the moment you say Coca-Cola, yaa ngi project an image.
déedéet am na ñoo xam ne dog bu ma dugal am na ñoo xam ne ni slim rek a leen ne baakee moom.
waaw.
yow way of loving comme Omar moom.
Boy, bu ma
lu
tooñ
dee
nag, bu ma tooñ,
comme
boy.
Omar 23 years of relationship bi mu built. xam nga lu ko fa teg because of certain things. maybe dafa admire.
man moom wax naa ba
waaye man lu ma believe mooy kéemoo soo demee ba taana jabar right.
wax
danga ko taane because you want to elevate along with her grow with her understand nga soo ko taanee ngir features soo demee ba gisaatuloo loolu noonu di nga daw so loolu mooy tax society bi léegi góor.
Pap, sometimes you talk as if you've been married for 30 years.
na experience
Man moom a jaaxal.
no dog experience
Tey kii 8 months la xam.
7 months
Qualify guloo pour di dugga si yenn yi.
dog no waaye
xam nga loolu maturity la
thank you very much loolu moo tax always ma day use gratitude
Xam nga kii lu ma ko wax. Who Sandanka waaji.
Dog.
lii history la de.
Dog,
Xam nga last time maa laa wane loo fi wax.
dog
Internet bi léegi.
dog
Will be held against you.
de wax anglais boobu noonu gratitude is the sign of the noble soul nit ki waruloo or sa partner
Waa xam
because
nga
of
li
certain condition
xam nga li ne wax posterity.
mooy maanaam tojal yax bi
Bàyyi sa xel sooy wax.
kon xaaral ma def ndànk waaye comme going back
Let me ask you a question, Pa. Su fekkee ne okay wax ngeen ne su fekkee ne you're already married.
Yeah.
loolu moom da ngaa manage.
waaw
manage nga wax
su dee takkaguma kay
Waaye lu tax nga use word bi manage.
manage
Yeah,
su dee takanguma kay dañoo
waaw foofu laa ñëw nag
Ah,
su
su dee
fekkee
takangu.
ne yeah so I mean comme ni yaa ngi wax Omar for 23 years
Yeah.
you know su fekkee ne you're not married is that something that you would consider?
Di nga taka jigéen bu nekk breast cancer survivor.
Yes, today my love for her is real. Then there's what we want.
Xam nga si saa si mu doon ini.
Because xam nga leew. Even su dee bu real sax because su ne bu real moom there's no way góor bi dina ko taka. Waaye su dee mbëggeel bi lu ko lal is something honest. You built it based on love, honesty, and commitment, Omar. Whatsoever might be the situation, you will go for it. Because da nga xalaat yow sa bopp, you could be a victim.
non waaye Pape aaral donc laajte na la fii.
Xam nga kii moom
psychological yi ngi very easy nga xam ne comme jigéen bi amul ween. nga ne
Man nag déglu lu ma la ma ne it's all down to the love.
déedéet Pape.
If that love is real, donc tey soo bëggee nit.
Yeah.
And it's been something that is real. Xam nga yow you might have a different way of building relationship or love with your partner. If it is built, moo tax ñu ne la love is a union of two people built on love, trust, and commitment, and not perfection. On that scenario, for instance, boobu noonu that jigéen comme there is something like it. Moo tax ñu ne not based on loo xam ne nekkul perfection. Su dee da nga ko bugga te yàlla tax si nga ko war a gën a mun a jàppale sax.
Okay, so
man de
theoretically.
xam naa ko si de Pape musuta nopp ku amul ween
jeex na tag man la di bi episode bi starté
musoo dog ko
te am na góor yu mel noonu.
Bàyyi loolu te la ñu Omar bàyyi loolu mooy.
te xam nga kii sa boy la yaa gën a laa xam nga suspect.
Omar li askan baa ñooy
déedéet yow da nga nekk di weer sa boppa xam nga lu tax ngay weer sa boppa subconsciously
gam ne
yow episode ba mu taa nampa boo déglu ma boo doon describe Coca-Cola bottle léegi kii weeral na la nag either way nañ dellusiwaat because lu ma laa wax rek mooy the reality is doctor lu may wax mooy psychological safety jigéen yu bari is threatened because the perceived sense of desirability dafa wàcce te góor yu bari duñ fa dee nekka
waaw am na ñoo xam ne dañ dee daw.
daf dee mën a tas sëy
Yeah. And they would sort of dwindle or send zeal to fight if they're gonna watch it because there's no
Or bi
support.
dafa wàcca.
So and that can actually affect their ability to be able to fight the disease.
yeah
You know, so the guy gets the I'm breast cancer, and I'm taking an example of an enlightened society wherein breast cancer is not contagious, it's not a death sentence.
Yeah.
The guy gets the support the data survival rates again are high, and Doc mentioned that we have one of the lowest survival rates. Yes, true, late presentation,
yeah
amnesty, but also that societal support, that family support, negofa.
yeah
So the guy need the fatela give up.
yeah
Because I mean, you have nothing to live for,
yeah
basically.
am loo si ko wéeru
ñeneen dañ lay isolate sax.
Yeah, exactly.
wala ñu and the fact ne bu nga see dugal faji nit ku ñu dem la liggéey xam nga
Psychological distress.
su nekkee yow so you nekkee yow in a polygamous society sa wuje bi wala sa awa baa la liggéey xam nga it just becomes very very
It's
da nga dee give up da nga dee give up fa nga toppa gaay. Lu ñu la wax rek nga def.
Because psychologically.
so
So it's a very important factor, and for Gori, they have a big role.
big
In
role
as much as we talk about breast cancer affecting women, but for Gori, you're gonna have responsibility.
yes
Don't go ahead. Like we're heads of families, you're major decision makers, especially in the African context. So we have a big role when it comes to helping fight against breast cancer.
Yeah.
And Lulu is a very big message. I think
Going
we
back
need
to
to.
and they're still worthy of love, affection, and intimacy, right? Because once again, it's not a death sentence, right? Because Lola, I'll explain, in that moment, do you stop touching her? Do you stop caressing her? Do you stop telling her that she's beautiful? So all those things psychologically, if it goes away because you withdraw, to have in society be no melt, right?
withdraw.
So your halata your intimate dynamic with your spouse, and then the moment favor natu jatko lo hamne, let's say she did not contribute, non-modifiable factors, right? Then you withdraw all your love and affection and intimacy from her.
Yeah, that's
You
bad.
can isolate,
That's bad. That's
right? So even Tabi soko tasutesa, right?
Yeah, don't give less time, less communication.
Yeah.
Or go and look for a younger woman.
That's bad.
Which is also, society will forgive you for it because then you're jabaram nafa
Moo
favor.
tax nga ko dee waxee I kid you not, men are protectors and providers.
No la ko de They allow it.
Yeah, and just looking at the flip side, I mean, there are few, but I'm not.
Yeah.
Men who stand with their women.
Yeah.
And generally, we've seen those women tend to do better.
Definitely.
See?
One then, somebody who every appointment, jigéen bi suy ñëw góor bi mu ngi fa.
Yeah.
Oh,
I had a patient who góor bi moo ma dee gën a text, moo ma dee gën a call, just
Jàmbaar.
following up on it. And you know what happened?
You get tried.
That patient is a survivor for almost 3 years.
Wow.
But them, after diagnosis, treatment, mu am dom, mu nampal dom bobu nonu.
Yes, sir.
And then, they're continuing disease-free. I mean, no recurrence because of that support. They got a treatment has an impact, but the support also
Amar will
helps.
be there.
Yeah.
Amar is a stand-up guy. Amar mom olo na ko.
Dog yow you know me.
23 years.
Na ko dog yow.
Ku mun a sega 23 kañ moom di nga sega for a few months.
Yàgg na.
Di nga ko lifin de.
So psychological support, very key. And I think Lolo, it transcends cancer. I think in general, men, we just need to be supportive partners in healthcare.
Definitely.
Because jigen yanyi they gonna topoto suñ mage. So confirmation process be, okay, the conversation, has it gotten easy for you telling a woman that you have cancer?
I think that's one of the hardest part of my job is breaking bad news.
Oh,
And nothing prepares you enough for that.
Yeah.
Because as a kunega, every individual is different. Different in the sense that we have different levels of sensitivity. We have different levels of tolerance. We have different coping mechanisms.
Yeah.
So I guess being able to sort of perceive, those variations in every single patient is a challenge. And I say, you would tell them that they have a cancer diagnosis and they just freeze.
Yeah.
They don't know how to process it.
Yeah.
And sometimes this carries on. You have some people who maybe are in denial. Again, I've had a patient, unfortunately, who still doesn't believe the test results.
Wow.
So I guess that affects the treatment because it's just how is it me? How is it possible that I have this
Yeah.
disease?
Why me?
Yeah, why me? So again, there are challenges when it comes to sort of breaking bad news, to patients. Nothing actually prepares you for that. But what we try and do is have a dialogue and sort of breaking the news, but also trying to show what the options are in managing it. That despite this bad news, there's still hope. And that hope is really what helps the patients get through that journey. Then I guess the statistics in the US, for instance, so if you have 10 women who have breast cancer, where in 2025, if 10 women were diagnosed with breast cancer today, 9 out of those 10 women would be alive in 2030.
Yeah.
So in 5 years, only one person may die of breast cancer because it's diagnosed early. After 10 years, you would have 8 people who would still be alive.
Wow.
So 2025 now, 2035, 10 people diagnosed with cancer, all get treated. 8 of them are still alive.
Yeah.
So that's far from a death sentence.
Yeah, it's not a death sentence.
So again, it's really important for people to understand that having a diagnosis of breast cancer doesn't mean you're going to die.
Yeah.
It just means that you're starting a journey that eventually, if taken at the right time, you can live, almost complete, almost normal life.
Wow.
The other thing, which I think is important that we're trying to develop in this country, is what's called a survivorship, network. We do have breast cancer survivors.
Yeah, they are.
So I guess that once a woman is going through that, processing the diagnosis, if they're in contact with somebody who's actually gone through that journey,
It makes it easy.
it makes it easier because then they guess, okay, I'm beginning this journey.
Yep.
This is the end of that journey, and I'm seeing hope at the end of the tunnel. So they feel better and they have more hope because they can see what the journey looks like.
It's a source of motivation.
Exactly.
Then they want to knit because you could see it.
Exactly. Yeah. And we're trying to encourage more of that. Again, we have challenges in Gambia because, again, the stigma.
And you have to be out there to take claim of it.
Exactly. So, they have breast cancer, they go through treatment, but I mean, because of the society, Bete, even if they went through the treatment, they probably had one of their breasts removed, they still don't want people to know about it because they would still be stigmatized. So the data, some survivors are out there, but they're not really able to network because of that stigma. So again, a lot of work within our society to change.
So when they remove it, they clear everything out, or?
You've never seen
No.
a woman who's had a mastectomy? You've never?
Yeah, I think I did.
One picture?
Yeah, I mean, it's very obvious that it's no longer there.
Yeah.
Not like that one picture, what a life.
Yeah, okay, send you for this life. No, man, like it, but
I
they
did.
clear.
I did.
Yeah.
You know a survivor?
No.
You know a
See,
survivor?
No. Chemo?
Yeah, I know too.
Listen.
Yeah.
No.
Yeah.
No,
So
that's
they
fine.
remove it, they clear it completely.
Yeah.
But one thing I said, and this is something even in the Gambia, I mean, there are possibilities of doing. They want to reconstruct
Yeah.
the breast.
Yeah.
So it, at least on the outside, don't want to we even did surgery.
Yeah.
Yeah. So
Mashallah.
definitely it's possible. So that feminine form can still come back.
still there.
You know, after your treatment.
am na góor yoo xam ne loolu rek leen dee xool.
Du loolu laa la wax fii nii yaa ngi bëgg a bañ.
Man kay waxul
No,
man de.
but either way, I mean,
But it's normal.
but I mean, no mel at the time boko taka.
Waaw.
So la nekkee 55 du mel noonu di.
Déedéet waaye fekk yéen ñaar yëpp melu leen noonu kay.
Yeah, but life is gonna happen. Yow tamit xam nga lu ma miin tamit. Yow tamit sa góor yaa nu meloon 24.
Waaw, yeah.
74 bali du fa nekk nu mu fa neloon di. So it's just part of life too, you know. But I mean, technology is getting better, surgery is getting better.
Yeah.
But just going back to what you said, I think there's a level of confidence that lum leen di jox when they come to you guys early.
Sure.
It makes the conversation easier.
Sure.
Right?
Yeah. And just to give you statistics, I mean, just in the main hospital, I mean, we did a study of the patients who come in with breast cancer, and we looked at early stage and late stage. And it's no surprise that about 70% of our patients actually come late.
That's the
So
biggest problem.
that's
That's
a
a
lot,
low.
like-
7 out of 10.
So, Doc, is that down to the level of sensitization or
Very much.
awareness?
Yeah. I mean, again, and sensitization, I feel this is really our
Yeah.
gateway
I think,
Yeah.
I
because
think we
it
should
costs very little.
definitely.
Sensitization, moi, you go back home and then you talk to your sisters, your mothers.
Yeah,
This is
and
bad.
that's not only help.
And the
personally,
man,
everyone could.
Yeah,
everyone
anybody
could.
can do that.
Agori.
Yeah.
I keep emphasizing that. So
keep
this is so get destigmatize a lot of things. People that should not be talking about it should start talking about it
kid you
because
not.
young can normalize. I mainly period shame.
And I kid you
No, dafa
not.
mel ni period shame. ñun buñ nekkee xale da ngaa dem jënd pad ñu rappal la ko si newspaper ngay ko nëba. waaye léegi yow soo góor nga dem supermarket teg pad bi si kaw counter bi nga ne ko bu ma jox baag.
No, man loolu laa dee def
man
sa
at
doc.
the labor ward man defaral naa nit pat jigéen yi fa nekk xale students yi gars yi break.
No, waruloo.
No, they thought I'd how ma I don't know how to do it.
Yeah, but it's just it's so alarming.
Dafa mel ni it's not normal.
No.
Wala ñu ne la yaa ngi jaay
But
duutiir.
Gambians, I don't want us to skip this part. Even people in the diaspora watches. ñu ngi ñoo wax ne study bi 70% came late. Understand nga loolu lu mean.
70% of cancer cases.
Déedéet ñii seen
What?
study buñ defoon.
Yeah.
Right?
Yeah.
Buñ
They
find
came
out
late.
there 70%.
Came late.
Yeah.
And there are so many reasons.
And these are typically women seek healthcare. They have better health seeking behavior
Yeah.
than men.
Yeah, but I mean, just to tell you that 70%, when you got in America, UK, whatever, it doesn't change because Lulu, that 70% should be before they get to the hospital.
Yeah.
So when you have the best equipment, the best surgeons, the best whatever, but Lulu is not going to improve their
Yeah,
chances.
because
Yeah.
they came.
So the best thing is for people to be sensitized and come on time. And it doesn't cost anything.
No.
Yeah.
I mean, you don't need to spend top dollar or, a lot of dollars to
You're
get
going to
that.
sensitize them.
Donc yàlla ñun kaafale ba mool leeja.
No.
No ñun dul kaafale ba mool leeja dafa nan ka tara health worker leeja. Ntela mirota. I always take example from myself as a midwife. Do je ika moja mi an ko invited ni pour foto. Bari hakiro bukata breast cancer fa motade ndar kam miro marriage miro wo time wo di track la ñamel
That's why you need to study yourself. Da nga war di observe sa bopp as a human being.
non maa ngi bëgg a wax knowledge gap bi tamit
knowledge gap
Yeah, knowledge gap.
knowledge gap
Yeah.
because sometimes dañoo ñëw ñu complain la ñu ne suma wenn mu ngi métti nga bindal leen antibiotique ak painkiller gars yi dem they keep on taking that so foog naa ne knowledge gap bi tamit am na ñoo xam ne they will still come dañ leen la ko wax maybe ñu call la nga wax ba mu jël antibiotique
Ak also nga xamee sa color ween bi is very important.
waaw su nekkee yaa ngi xeesal nag
waaye su ñu joxee sa doc sos
déedéet
comme yow loo mooma doc da nga ko war a xamee.
Waaye-
su ceeñee nga xam ne
déedéet waaye lu ma
am
miin
na
ne
ñoo xam ne ni seen bub si dañoo change color sax they won't know.
déedéet waaye
duñ dee bàyyi xel dara. Even góor sax you have to recognize what you own doc. That's the bottom line.
déedéet what do you own
loo moom ci doc.
bul digga sama problème moomu loon dara de
moomuloo ko waaye loo amee tamit nga xamee ko doc su changes amee nga xam doc because ñeneen day breast cancer sax.
okay so let me reframe your question in a way that will not get you in trouble first of all moomu loon dara
moom dara
right what is the role of married couples in their intimacy environment when it comes to protecting women against breast cancer? Because I think intimacy and things of that nature, if your wife has a lump, maybe you may notice it before she does.
bu baax kay.
man foog naa ne sax if you notice it at that time nga encourage ko dafa daw dem ci la
non dafa dem si.
Because you've made it normal. No woman like daw them. You're not going to anda.
nañ ànd moo tax Omar góor yi dañu war a xam lii
Let's start changing that. Xam nga lu ma mean tamit.
non donc fii octobre
Déedéet.
foog naa ne sax pour góor yi la
Te dañoo challenge góor yi sax. If you have a significant other,
Yeah.
October, jàmbaari dëkk bi yëpp ànd leen
Wow.
ak seen sister si
Campaign
sa
bi loolu la war a
significant
nekk
other.
right now.
And we're going to run the promo because he'll talk about the Solace Foundation when you're there.
Exactly.
Ñun campaign bi fii September yëpp every episode we're going to talk to people about making sure screening happens. Why I want the male psychology to be Demal said,
No.
let's change that to nañ ànda.
nañ ànd
Yeah,
dem
nañ
seet.
ànd, yeah.
Nañ ànda.
Nañ ànd,
because
yeah.
yéen a ko dee ànd di ko.
Te waxoon naa ko fi the last time
Ànd
man
dem seet.
full man right my significant other suma jabar xanaa munuma ko de anytime they have a medical encounter I want to be in the room
Yeah.
very important
that's just fixed unless I am unable to physically
Physically.
Right.
Omar will you?
Sure.
Yeah.
right
Ali Baba
so
Kumba naa.
nañ ko change from demal seet to lan
nañ ànd.
Nañ ànd.
fa nekk
ma ne CEO boobu dafa nekk t-shirt sax
waaw nañ ànd.
let's go together
nañ ànd
nañ
Right.
ànd. boobu kay dinaa si sawar ànd kay.
ah
dinaa si sawar especially part boobu sax ñu bëri dinañ si sawar.
yes we'll do our addition that's really important
Yeah.
Yeah, and again, it's just
part of your explanation tamit bëgg naa nga laal si skin cancer dama ko dee
déedéet
dégg.
buñ tëb Then finish because patient journey la.
I'm not his
He's talked about the diagnosis,
Okay,
the revelation. From nekani, what happens next? Ko hamne amun njegi dem Dakar, am njegu dem mota Gambia bi. So buge protect prevention and early detection.
Prevention is
It increases your options that you don't have to travel outside. And it also gives you obviously a chance of success rate, right? So once the diagnosis happens, from your perspective, what's next in the process?
Okay, doc.
What are the options?
Yeah.
so suñ demee ba diagnose and confirm the lead breast cancer la.
On average, how many months or weeks would that process take?
So it depends on whether you are, again, in a public or a private system. And Lul, it's not preferential treatment, but it's just based on volumes.
Yeah.
The public system be, obviously, there are more patients, larger volume, so process with the big and ideal time. In a private setting, there are fewer patients, so it takes less. But on average, from diagnosis to confirmation is about 2 to 3 months.
Okay.
Yeah, because this is in the public sector, because obviously, from your examine la, get a def scan, so the face scan, when your appointments, and then eventually you def biopsy more than ideal time.
Time, yeah.
Because Lolu, they have to really go through, and their process to should be accurate. So it does take time. So it's on average about 2-3 months, and this is similar even in other countries.
Other countries, yeah.
as
I was
well.
going to say that.
Yeah.
And that's
So-
very important.
Yeah.
Yeah, it could take up to 3 months.
Gambia, we're slow or anything. That's just, how, the normal how
procedure.
things go, especially in a public setting. So once Loli Yip happened, again, we come back to early and late. It's important. So
Describe late, because he's mentioned late a lot.
Yeah.
And most cancers, you'll hear late stage. What does late mean?
So late in breast cancer means that the cancer is no more a small lump. So it's actually taking the whole breast, or it's moved from the breast to the lymph nodes and possibly to the lungs, to the liver. That's like, you can't just do surgery on the breast and gonna, okay, jahna, because yange still cancer in the liver or maybe in the lungs.
So it impacts how you treat it now, at least how to manage it.
Exactly.
Yeah.
So I may diagnose me from you said, is it early? Is it late? If it is early, that's what we want. But unfortunately, less than 30% of our patients come at that stage. So it's late. So lolu tamit defa gena
jafe loo liggéey bi.
exactly. And secondly, tamit it's costlier.
It's more expensive.
It costs more. So the guy gives even yosa ame halisa. It's difficult. And I'm sure Doc can speak about this. Cancer makes families go bankrupt.
Yeah.
In places like America. And
Yeah.
So
Completely.
I'm gonna
kon
insurance.
de fii moom dañoo yuuxu kon.
So
No,
yeah,
you can. And look at how daw yaram si lol, xam nga lu si nekk. Yaa ngi agsi late stage, so your prognosis are bad, right? And families léegi mun naa jël xaalis boo xam ne mun nañ see dunda for 10 years, you spend ko in 1 year,
Knowing the
and you
fact
still
that-
pass away. So it's a double loss.
Oh.
It's bankruptcy and loss of life.
Therapy bi rek fay.
It's expensive.
so again, more than you sensitization.
Yeah.
You know, it's very, very important.
tey man ëllëg su ma demee dama rees ten nit laay waxtaana Omar
October mu ngay ñëw de. Dugal nañ si.
Omar yow nga jël 10.
man caako yëpp.
No, jàmbaar yëpp ku nekk sisters yu nekk seen koñ xale yëpp. Yeah. And we'll talk about an event that Solace is doing nañ si duga. But treatment bi, yeah.
Yeah. So again, treatment be, if it's early, we're all happy, patients happy. We know that we got this early and we can do something about it. So basically, treatment be munna wax ne ñu ngi wax, you know, if you have the options of going outside. But I can tell you with 100% degree of confidence, we're treating breast cancer in this country.
Damn right.
And
Hey, yéen a ngi
people are
dégg
getting-
loolu.
We love that.
Gambia nga yow.
We love that.
And it's important.
Yeah, man.
Yes, of course.
Yeah,
Of course.
and we're getting good results.
Yeah.
And again, when they come early, the results are great.
Yep.
So the treatment of breast cancer, we can either do surgery. If it's early, you know, it's not the whole breast that we're removing, it's just part of it. If it's late, then Lulu.
Complete
Yeah, complete mastectomy. You have to remove the whole breast. So surgery is there. It's one of the mainstays, one of the main options when it comes to breast cancer. But we also give chemotherapy. So chemotherapy are like drugs that are really powerful.
Yeah.
Like drips that we give, and then that helps to fight the small cancer cells that might have escaped. You know, and that might be responsible of what we call recurrence.
Yep.
Meaning that the cancer coming back. So you just want to reduce the chances of the cancer coming back. So they do chemotherapy. The third option is radiotherapy, which isn't 100% necessity, but it can be used in certain instances where surgery is not sufficient, for
Yeah.
instance.
Yep.
So radiotherapy is the third option. While unfortunately, that's not available in the Gambia.
Yeah.
But just with surgery and chemo, we can treat a good number who don't even need radiotherapy.
Yep.
Again, early presentation is very, very important.
And usually it's only one breast. Or some
Usually.
you do see. What would you say is the percentage? Ñaata yoon nga dee gis nit boo xam ne dafa folase ba pare ñaari ween yëpp they're affected.
I think majority is one side,
Yeah.
one-sided breast, but maybe about 10 to 15% of patients can have both.
Both, yeah.
Sometimes it starts on one. If it's not treated early enough,
Exactly.
it goes to the other one. You know, because again, it's breast tissue, same risk factors, you know, yeah. So it kind of like comes out on the other breast.
And maybe question tamit pour leeral su nekkee jigéen came early, which is success. I think the target should be 10 years from now, so in defee the same study, we flip it.
Yeah.
Where 70% came early, right? That should really be the goal. That's how you change the health system.
Yeah, and
But let's say kenn ñëw early, ñu génnee lump bi, and they go into remission. And then they have a child, meaning they still have one viable breast. they could still breastfeed normally without affecting the child, because that's also very important pour nit mun a xam ne nekkul ne poison mooy génn si jigéen bi.
Definitely.
So it's very important pour nit mun a wane mun ngaa dem through the process, you're a survivor and you still have children. Breastfeeding is still possible and recommended with the breast that you have.
Sure, and I'll just open a little bit of parenthesis here, in the sense that I guess that one of the misconceptions that women have, especially in New Nampa, some women may have a small lump, but once they get pregnant, towards the end of their pregnancy, the lump starts increasing.
Yep.
So when that happens, then they what traditionally, company dombi or halebi, defage. Or
yow da nga prepared de.
non dañ la danga ko dee dégg.
non loolu bëri na sax de. xam nga maa ngi wax knowledge gap bi fii nii.
suma doom bi dafa gi.
waaw dafa gi suma wéy.
Yeah.
And then
And that's what they say.
Yeah, am na ñuy dem ci marabu yi dañoo jël foog nga ko mën a ñaan.
Mirango.
Mirango ci olof.
waaw maat.
Domital.
Poli fu ñu la def sow nu mu tudd.
Calabash.
so ñu ne dañ ko
leket si
def ñu ne ñu ko raxas. loolu yàgg na. loolu meer yàgg nañ koo def de.
Omar dafa am loo si bëgg a doole.
non comme lu mu wax ni suma brother Jabara moom lii moo ko rey. xale bi mi ngi am 6 months. comme loolu ñu ne dafa gée. within few days dem na.
What?
Yeah.
I'm telling you.
So that's a very big misconception.
I'm telling you. So that's comme kii moom lu ma wax ni dem nañ yóbbu si meer xaw ma ñu raxas def nii xaw ma ñu mocc ween bi and all of that.
nipple ñu def des crack.
ñu fa dëpp ay leket looy dëpp ay leket. dëpp ay leket si ween.
Yeah, so
am na lu ñu fa war a génnee.
li dafa daw yaram trop looy
xam
dëpp
naa ne we have to protect the breast for pap.
looy dëpp ay leket doo dem laajte nga dëpp ay leket.
So okay, that's important.
yeah.
So doc, without even symptoms,
No,
how often do you take?
Kyle mu
Bàyyi ma daaneel.
déglul doc.
maa
ngi ko jàngal.
non ñëwal si guerre bi Pape.
Yeah.
guerre bi.
So Lula because it's something we see a lot.
Okay.
Yeah, and unfortunately, breast cancer in pregnancy can be really serious. I'm going to want that pregnancy protects. Why? So if I get enough breast cancer and then they become pregnant without treatment. It becomes worse.
Yeah, absolutely.
Yeah, so that's really important. So again, coming to early stage, those are the treatments that we do: surgery, chemotherapy, radiotherapy, abnegation treatments, targeted therapy, hormone therapy, because hormonal therapy is things like tamoxifen. We do give it because like the level of hormones, then it sort of like slows down the cancer growth and things like that. So we have hormone therapy here as well. They're pills that you actually take. So it's an early stage. Late stage, unfortunately, it's more of symptom management or palliative care or end of life, depending on
hospice.
So again, we still try and make life as comfortable as possible because Jaiteh, and they are within a family and a society. So mainly it's trying to palliate symptoms like pain. Give them strong medications, painkillers, morphine and things like that, just to make their existence, whatever is left, to be as peaceful as possible. But again, that's not what we want to see when it comes to breast cancer. We want to be able to pick them up early, and be part of that, 9 out of 10 who are still surviving at 5-10 years.
And living them up.
And again, Nyun in Gambia, it's younger females. I touched a little bit about it. Why I guess that these are we talked about women, they're the ones who are feeding their families, these small, sales, you get them So, if you take a woman out of the family...
Oh, it's catastrophic.
Yeah, that's the end of it. The way they're supposed to be taken care of. So it's a big problem. So mortar breast cancer is really, really important. And then in Africa, Gambia included, it's the younger women. So they may America,
it's the older,
Europe, it's the older women. 50, 60, 70. Gambia, our average age is about 46.
That's wild.
That's on the high side. We have seen less than 20-year-olds getting breast cancer.
That's wild.
So it's a big issue, and I think we should be talking more about it. Mora Pinko Kutubo, it shouldn't just be in October. We should
It should be
continue
every
talking
day.
about it. Yeah.
Every day.
And I think men need to champion it. But also going back to end of life care, because what's going to hospice? Like end of life care.
No.
Nga nekk di treat ko xam ne you know that they are going to die.
Palliative care.
Lola
Palliative care.
Lola Bugona like
Right.
so doc, do you at any point make a patient know that he or she wants to make it?
Of course.
Do you? Have you ever experienced that?
Yes, I mean, you have to have that tough conversation. Mora Manila, that's the hardest part of my job, breaking bad news. In as much as you don't want to frighten them or discourage them, but you need to tell them the truth. I think at the end, your patients would thank you for it because I guess psychologically, they'll be more at ease. Once they have accepted their faith, they would be more at ease and, they'll be able to accept it more. I've actually seen societies wherein a patient who has breast cancer and then the whole family knows about it. And this is cultural. It's more towards the East Asian countries, wherein the whole family would know the diagnosis and the patient wouldn't.
Yeah.
And in those societies, it's not done out of bad intent. It's just that they feel that the patient needs to be protected.
Yeah.
But yeah.
Again, I mean, there's a lot of debate on whether that's the right thing to do or not. But again, it's just showing how different societies manage those.
But
kinds
at
of
least they
situations.
built a community around it.
Yeah.
Right.
And there are certain patients that will insist.
Of knowing you.
Yeah.
No, but would you want to know?
No, that's their right though.
David, would you want to know?
No, if it is me, no.
You'll never want to know.
Medically,
Right?
it's there,
No,
right?
me, no.
Would you want to know?
Yeah, I would want to know.
Sure.
Yow doo bëgg a xam?
No.
Yeah.
Duma rek ay
Man, I would really want to know.
Non man
Why?
tey sax nit su ma mënoon a jox date dama koo jël.
yow American nga yow. Man
Man,
sa
Non dëgg la de.
ragaluma ko, Pape.
Omar yow emal ragal loola.
But
Yow
Pap,
ñu wax la ko. Non man bu ma
I'm gonna mean why it's important. Halatal culturally, it allows people to plan.
plan. Yow ngay dee nga naan plan.
Déedéet. Xamuloo ne even Gambia fii nekkul jigéen ak góor yi. A lot of inheritance issues, a lot of just things that you could have sorted out, writing a will, make sure things are in place. Even nit ku su amee 1 week, nga wax family members yi, shower them with as much love as possible, indi leen diine bi around them as much as possible, which is why a lot of hospices in America, there's like a pastor every single day, dafa ñëw, dafa ñaanal nit ki.
Yes,
You maximize every single day. So you wear that every single day, sir. Joxal nit ki opportunity.
amuñ de am na ñoo xam ne nii suñu waree live 30 days nga ne leen yow 30 days moom si next day bi dem ne.
Why do leen what
No, du
exactly
jaar.
30 days?
Waaw dama laa jox exemple rek soo ko waxee ne yow lu la desel fii bëriwul.
But it's honesty though.
Yeah, but some people man.
So da ngaa jox nit yaakaar.
Man kay moom.
Ne yàlla baax na.
Man bu ma kenn wax dara.
Doctors cannot operate on yàlla baax na. Xam ngeen ne ñun Gambien si bari inshallah ak yàlla baax na.
Yeah,
Kii du mun a dugg si patient room wax nit ne
I
inshallah.
prefer not being
So
informed.
hospice, I mean, generally there's this saying that in hospice, you're adding life to years.
Yeah.
So meaning that the opposite would be adding years to life.
Yep.
Meaning that you're trying to increase the number of years.
Yep.
But in hospice care, you're actually trying to add life to whatever number of years you have.
Yep.
And that means quality living.
Quality living.
Not being in pain,
Yep.
being surrounded, whether it's spiritual leader, your family. So loli I'm not solo. And what I'm like, even in late diagnosis, I mean, there is something that can be done.
Yes.
It's not the preferred option.
Yeah.
Why, if that's the only thing, you can still help those patients out. Psychologically, it really helps to know that you're surrounded by loved ones.
And for people in the diaspora, it gives the families a chance to come home.
Yeah.
People underestimate how important that is. A lot of our system, so many people pass away without their family members in the diaspora having an opportunity to say goodbye. The legi am na ñene si diaspora ñëw in Gambia for 10, 15 years. So if it's late diagnosis, bala ñoo pare just to come, meer bi wala pa bi dem na. Right? So those conversations are important as well too.
So doc, without even symptoms, how often do you think women should go for these checkups or exam?
So again, there are international recommendations. And in our own context, we do have recommendations based on our reality.
Okay.
So mostly, I guess, in Western countries, then they want so I'm a 50-55, you should get a screening mammogram.
Yeah.
Screening mammogram is more do har binga donja. automatically. When you clock 50, some countries a little bit older than that, one guy to doctor bi.
Yeah.
You definitely mammogram in your hall.
Yeah.
Because you're having the importance.
And you know
of
that's
early
not
detection.
common here. And
No, but it's embedded into the
Into
in the
system.
primary care.
Yes.
If I know what prostate, like you turn clock 50, they're gonna slap that.
Yeah. So again, Lulu, there's a lot to talk about because in that system, you need to also have the capacity to be able to treat.
Yes.
You can't talk about screening without treatment. Because if you screen somebody and you tell them, okay, you have this,
And
you can't treat,
Yeah.
then you're causing anxiety for
Yeah,
nothing.
yeah,
So
yeah.
you need to be able, the two go hand in hand. So in Gambia and most other countries, it's not actually screening per se. We use the term screening, but it's more early detection
Early detection. Yeah.
because the capacity of the healthcare system we have is not robust enough to be able to handle non-symptomatic. Because you get new symptoms, it's being overwhelmed.
Rangmangi good ayang.
Yeah, so adding that on is difficult. But notwithstanding, Asian countries have proven that because they have a similar issue. There was a study that was done in India that showed that early detection can actually save lives.
Yeah.
So even if a lump appears, once you detect it early, it is close enough to be considered almost a screening process because when you do treatment and you're able to do. So in the Gambia, instead of waiting for 50, we would probably, looking at our average age, around 35, 40, you need to start getting regular checkups. And at 18, you need to start feeling...
Being able to.
Yeah.
Exactly.
So that you'll be able to tell if something is unusual.
Are they teaching it in high schools?
There's no formal structure that's doing that.
Okay.
But with us in Solace Foundation, that's really our next target.
Fantastic.
Trying to go out to the schools
That will
and
be
then
very
teaching.
pivotal.
Teaching and trying to, sort of create awareness.
Yeah.
I've actually had, somebody who's in the tech industry who was telling me the other day that, she actually got interested in breast cancer research because we're doing something together, tech and health. And she was motivated to do that because she had a classmate who had, I think, an aunt who sort of, had breast cancer. And that was the first time she actually had contact with somebody who...
It became real.
Yeah,
I think even community sensitization could help.
It's important. I think that's the key.
Yeah.
It is very, very important.
Unless
And demystifying all the misconceptions, but also localizing it in terms of language. Making it a male-female conversation. It's not just stigmatized.
waxtaane biir nekk.
am na solo.
Lan
ma ne ko am na solo yu doon.
lan doom ya.
Yeah. So Doc, man fu ma bëgg a ñëw rek mooy wàllum garab bi. How expensive or how easy is it to patients to have these medications?
Very important question.
Yeah.
We said that breast cancer can sort of cause economic havoc in a family. But I can say in Gambia, our healthcare system is such a way that even those who are on the lower level economically are able to benefit.
Yeah.
So in terms of surgery, for instance, in the public sector, Bungam surgery be at a fraction of the cost. They can get their operations.
What's the average cost?
I mean, for surgery like that, you can pay as little as maybe about $4,000.
That's very good.
Yeah.
Context is
In
important.
America?
Did it?
In Washington, D.C.
Dumana America. Jalal Amdalai rek. I keep saying this, and I'm not saying this because he's here, he works at Edward Francis. Then yaps in health system. We complain so much, but we don't understand how grateful we should be that we're doing so much with so little. $4,000 is not even $100. I don't know anywhere in the world where you could have that surgery for less than $100. Right? But continue.
Exactly. So the surgery, I mean, that part, most Gambians have access to that, at a relatively cheap cost. So it's the chemotherapy, within the public sector, although Yenisai there's it's out of stock. But again, the cost of chemotherapy is a bit high because nekkuñ ko manufacture. So garab yooyu noonu foog ñu jógee bitim réew pour ñu mun a ñëw. So that is what makes it a little bit more expensive. Waaye su fekkee ne we're in a period wherein garab mu ngi si lopitaan bi, it's relatively cheap. So in America, xëy na foog nga am insurance, nga am cancer care. While in Gambia, you don't necessarily have to have insurance. So the treatment is actually available. What we don't have is radiotherapy. And radiotherapy is not a must in all cases. There are indications for radiotherapy, and people can get treated for breast cancer in the country without having to need radiotherapy. So it's something that can be, it's affordable actually, for patients.
That's cool.
And the easier it is for us to source medications, the easier it is for, for everything.
Afram fanche manika ko isa joko na mol isa understand yalam tol na manika man sene amar fana ama may ba
manika ko mo
nte bada bada bula
Ay,
bada kapitalo
fara fenya Omar ma moy Omar la maniko man sene bari ite sa afram fanche no
ya comme dokka min foten wala jaralo ni na karola ako kadu ni mo jibe foya jara jararo ni na karola ko ni ajibe Gambia ni a compare ni banko dol Gambia ta mon ko ya bake jama wulinane wala abukatan do wal ako ko la fan o man na tan ni ka boro la karola ko ni aja boro da ka jabe ya wala boro ka bonan dulalu do na boro ni da ka jabe ya do wonde wala min ka fula je fana wala hana man ke kantani damade Gambia damalam banko ti mi an kon tele min kala mota ibita loptano de mo ni lulojo e docteur oje wala no soje free of charge ba hani bi mun ko complain ko mi mun boro dire men jibaren kan nina e moment taraje ay jiwero min ke anay taking care of min ke mi an ko imajo
and just in terms of costs, and American stuff. So without insurance, lumpectomy, it could range from $10,000 to $20,000. Mastectomy could go from $15,000 to $55,000 as well. India, you could get it for about $4,000. In Africa, it varies from country to country. But I'm pretty sure there's nowhere in Africa where it's less than $100.
No.
Right? So it's just all relative as well, too. That's why early detection minimizes costs. And obviously, from a medication standpoint, we know that chemotherapy sometimes could also affect women because the medications have side effects as well, too. It affects women in a way that now society could know that something is also happening. So maybe even if you want to touch on how that is incorporated as part of the process as well.
Sure. And it's one of the things that we talk to patients about pretty early. Because in as much as we're talking about the surgery altering the anatomy or the physical appearance of a woman, chemotherapy also has a huge impact. So some of the side effects that you can see in chemotherapy, one of the most obvious ones, and I'm sure even if you're not a doctor, so you know, hey, chemotherapy,
loss of hair.
Loss of hair it's big. But the good thing about that is that it's reversible.
If that did also what? It comes back.
So chemotherapy, just as if it never was lost. So Lolu, it's a big advantage. The other side effect that it's common with most chemotherapy is vomiting. So vomiting is something that happens, immediately after giving chemo. While some people are more prone to vomiting. They get chemotherapy and they don't vomit at all. And we try and anticipate that in medications with the chemotherapy that will help reduce. Exactly, ondansetron is one of the big ones. That we actually give to help reduce. Vomiting post chemo. So mun nga am yenen side effects which are specific to the chemo because chemotherapy drugs
there's a wide range.
So depending on the type of chemo that you're getting, then there are other specific side effects. Why the good thing is most of these side effects are only temporary. Treatment everything goes back to normal. So again, very important.
So pap, façon yoy. Sweet kawaram bi dewe, yow tamen dalul. ngeen ànd dem wig shopping.
Definitely.
Thai wigs mom. I know our sisters, the wig game is so strong that there's options there. But it's just a process. But once again, I think the recovery, I like seeing success stories. Because pull man that they want those people especially that are courageous, that they ba niti muna wane li dunda nako, why change it to my life, and I'm still living happily ever after as well too. So coming back from Solace Foundation, because I know October, Mom, we're going to keep reminding people about the importance of Pink October. Hopefully, corporate social responsibilities, a lot of companies, awareness will happen. Hopefully, this episode is something that a lot of people nenko setan, dinenko share, offices in mungena watana nyam. But also Lamin, besides all the things lumnekari def, he's had a foundation called Solace Foundation that they've been doing a lot of work. So I really want to dedicate this time to explain a little the origin story of Solace Foundation. What activities do you guys have? Right now, the reason we talk about because you get the fundraising for your awareness. To tell you what time be hamgen the Lee.
Definitely.
So anybody who set an episode will make sure we provide detailed information in terms of how to join the continuous support, because Nyamsen Ligue today October rek as well, especially ñoo xam ne ñu ngi nekk si diaspora bi saa yu nekk nit si diaspora dañ ma dee laaj naka lañ mën a dimbalee. I think breast cancer is one of the things as it affects all of us. Muy góor, muy jigéen, suñ sisters si, suñ brothers si, te xam nañ ne early detection mooy suñ secret, Gambia. So tell us a little bit about Solace Foundation. What does October mean to you guys, and just anything we need to know?
Yeah, exactly. I mean, Solace Foundation, like I mentioned at the beginning, it came out of the necessity or the feeling that in as much as I work in a health facility, a lot of the work that can help improve our outcomes needs to be done before they get to the hospital.
Yep.
So Solace Foundation came about when a group of like-minded people, like myself, we have people who are not even in the health sector, people in the banking sector, people in engineering, people who are really generally concerned about health and trying to see how we can have an impact. So we got together and then we formed the Solace Foundation. So it's a nonprofit organization that is focused mainly on chronic non-communicable diseases. Yep. So hypertension and diabetes, because again, we know that these are sort of risk factors to a lot of the other, more severe cardiovascular and certain cancers as well. So we are very much into awareness creation, and we talked about awareness here because we feel that that is a low-hanging fruit, and which can pay a lot of dividend and help in what we're trying to do on the other side. That's the hospital side. So we've had a lot of community outreaches. We've gone to remote communities, both within the combos and outside the combo, wherein we sort of enlighten people about when it comes to the hypertension and diabetes, but also cancers. And the initial focus was on women cancers, again, because of the statistics. And we're venturing more and more into other cancers as well, liver, prostate. And the reason for this is we feel that once people know about cancer, they can probably come to the hospital early. And that's been the theme throughout, this whole show, getting people to know about it, talking about it, and then eventually, coming to the hospital early enough. So we're very much also into screening. So every October, we collaborate with different health facilities. For the past 3 years, we've been doing it with the Edward Francis Small Teaching Hospital, wherein we jointly organize the breast cancer screening, which receives patients not just within Banjul and Combo, but patients from outside Combo who actually come in to get screening. And this is done in collaboration with partners as well. We have banks that help contribute to covering the cost of screening. We also have NGOs, we have different institutions, we have different groups that also come in, to see how best this screening can be made available, because we don't want affordability to be a barrier to people getting early detection, when it comes to, cancers and either ruling out or confirming cancers. We're also very much into sensitization. So a lot of radio shows wherein we talk about cancer, TV shows as well, and on social media. We do a lot of advocacy. I think we spoke a little bit, Kemo, I think, talked about, healthcare workers and the capacity to be able to actually detect breast cancer. He gave examples of where you had a nipple retracted and, maybe it's not being detected as possibly being breast cancer. Although nipple retraction doesn't mean breast cancer always, but it's always good to have at the back of your mind that this may be breast cancer. So either I try and confirm it. If I can't, let me refer to a higher center that can confirm it. But it's important to know that that is a possible sign and symptom. So this year in February, March, we organized a training for healthcare workers. So we had doctors, nurses, midwives, and public health officers. We had about 300 in all the different regions of the country.
Oh, wow. And that was funded by the foundation?
Yes, with partners. With our partners. So we, and Edward Francis Small Teaching Hospital as well was a partner in that. We also had ministry involvement with the National Cancer Control Program. We're also strong partners in this, where we had trainers go around to different regions and actually teach and healthcare workers on what are the signs and symptoms of breast cancer, what are the processes, similar to what we just discussed, in trying to diagnose and confirm breast cancer, and the referral pathway, because that's very important.
That's important,
Yeah, because sometimes patients may have signs and symptoms, but there's no referral pathway for them to get to, the main teaching hospital wherein they can get probably most of the care that they need. So this was an exercise, and we hope that, with our partners, this will be something that will be ongoing in order to be able to help improve the detection rates when it comes to breast cancer. So we've been really involved in a lot of advocacy and screening. And this year, we're thinking of taking it a step further, where we feel that health is not just healthcare workers, just in the same way that Solace is made up of individuals from different backgrounds, not necessarily health-wise. We also feel that other sectors can get involved when it comes to breast cancer or cancer in general. So we're collaborating with sports, associations in helping, number one, to create awareness, and number two, in order to be able to help raise funds through sporting activities in order to be able to help people who need assistance when it comes to their treatment pathways. So some of them might not be able to afford some of the treatment or some of the cost of further testing. So hopefully the funds that will be raised will help in assisting those individuals. We're also looking at, again, the training we're talking about. We want to make sure that this is a continuous process. So again, some of that would need funding. And, with the fundraiser, with partners, we're hoping to be able to achieve that. So we're actually partnering with the Serrekunda East Sports Development Organization.
Fantastic.
So the fundraiser is going to be in the form of friendly football matches. I heard about Omar's great football skills.
Hey, team inaugurates.
Maybe we can borrow his services on that day.
And Pogba over there.
Oh, okay, and Pa as well. So again, just having fun on that day and making sure that we're able to raise funds for that. So it's slated for the 18th of October.
Right, Musa jot nga date boobu. Campé bi dañoo dem de.
On the 18th.
You know what? Dañoo plan sa pour def live campé event on the 18th.
On the 18th we'll be there.
Exactly. So that's the date for the event. It's at Serrekunda East Sports Development, mini stadium.
Time?
So the time is from 1 p.m. all the way to 8. So different activities. The football match is going to be around 4 in the afternoon. We're counting on you, Omar.
Even Bruno is a player.
No, Dohal can they're the footballers. I would be on the side.
Maybe Doc can be coach. I'm sure he'll be a great coach. So again, just using sports to sort of create awareness and see how best we can be able to mobilize some resources.
Absolutely.
To help in furthering the cause of breast cancer. And hopefully this is something that we hope moving forward we'll be able to, do more of,
Yeah.
and then see how best we can come together, not just in the health sector, but also the sporting arena to make, changes and impact when it comes to breast cancer care.
That's
No, that's great. How could people donate to the cause? I know in this episode, we'll put on at the bottom, maybe at this point, ways to contact the Solace Foundation. If you're in the diaspora and this touches your heart, you believe in the people behind it like we do, any single dollar that you go towards this, the primary objective is early detection. And the person who could be detected early could be your loved one as well too. So I really just, obviously Innovarex who believes in Solace Foundation, we'll do our part in terms of supporting, but we'll make sure there's details that people could want to volunteer. Some people have survivors in their families and their way may not be to come and speak up about their experience, but mun nañ see buga dugal sen loxo. So ñi lu tax ñu jóg daal ku si mun a yokka loxo, especially diaspora yi benn $10, $20. xam naa diaspora yi mu ngi tànga fu mu nekk nii tuuti. But it just goes a long way.
xeebuñ dara.
Te man pour fundraising lu ma dee wax mooy kan mooy fundraise, right? They're losing more, they're investing more pour TSC than luñ see jëlee. So ku si mun a yokka dara rek nga yokka si dara as well too. Anything else in terms of Solace Foundation that we should know?
Yeah, so again, it's a foundation that is very active when it comes to breast cancer. October, obviously, we all talk about breast cancer.
Yeah. So screening will happen on that day.
So screening, that'll be a fundraiser and awareness creation.
Okay.
The screening would be happening, again, annually we do with the Edward Francis Small Teaching Hospital.
Okay.
So that'll be on the 25th and 26th at the Edward Francis Small Teaching Hospital in Banjul. So fundraising on the 18th and then screening on the 25th and 26th in Banjul.
So 25th, 26th, especially in your hand, combo. I really, what's the earliest? Youngest you said, how young?
19.
19. So man luma buga challenge pour campe bi ñi dé sétane. 25th, 26th, right? Mark len ko sen calendar si. Gori dama buga ngeen gungé sax. The people that you love pour ngeen dem Edward Francis pour screening bi mëna happen once again. Ba paré ko xamné buga na yokka sa loxo. Pour screening bi gëna successful because hopefully they'll have a big crowd. They'll need resources. But just mark your calendars obviously on the 18th to come and support the fundraising event at Serekunda East. 1 p.m. to 8 p.m. No, they know them.
25th,
they know them for sure.
25th mom, if you're around Gunjur,
So coordination efforts. What's the role private sector could play?
I think it's a very big role. Again, private sector, we know that they have staff who are part of the community and the society. So we encourage private sector to open themselves up in sort of helping to create awareness amongst their staff. So we've had corporations wherein we've gone in and then held talks on breast cancer, and that helped enlighten, their female staff, but also their male staff as well. And we've also had private sector participation wherein part of their corporate social responsibility, wherein they sort of contribute to these screenings. Again, the screenings are free of charge for the patients. But in healthcare, they say healthcare doesn't have a price, but it has a cost.
It has a cost, yes.
And that cost needs to be covered. And I think that's where this collaboration between, Solace Foundation with the Edward Francis Small Teaching Hospital and other, companies or businesses can sort of come together to make sure that we're able to fight, conditions like breast cancer. So definitely a very, very big part to play. And at the end of the day, like you mentioned, the lives that they will be impacting might be, lives of loved ones, their staff members. It's a very small country.
Very small.
So
it's Gambia is 1 degree of separation. So pour what in companies, any company October 1st Taylor. If you're thinking about doing anything with your company about breast cancer awareness, please contact Solace Foundation because if we just consolidate resources, it makes it bigger, right? So at the same time, we have a dedicated body that year round, once again, just reach out. We'll make sure we put Solace Foundation's contact information. I mean, everybody has heard Dr. Jaiteh's story. We know Dr. Jaiteh does quite a bit of work with the Solace Foundation as well too. But definitely commendable work because I think 10 years from now, I would want us to see this again and that 70%. I'm really stuck on that 70%. Right?
Yeah.
Because loolu ñun si ñun la nekk.
Dëgg.
te dama ne wax ne léegi health system bi it's ask not what your country could do for you. Ask what you could do for your country. Dëkk amee wu ñu bor ñun ñoo amee bor dëkk. I keep saying that.
And I kid you not if you do so,
I kid you not, Pat. Right? As well too, man. I've learned a lot.
Yeah, definitely.
I've definitely learned a lot. I mean, most of my awareness, I think the biggest reality for people like me is suma janga bi America la, suma experience bi America la. So local context matters, especially from a specialist. But I'm so proud of you, Dr. Jaiteh, because what you are carrying, there's very few people in other countries in the world that benefit. Munna Anili. And I really hope this serves as an inspiration because most of the times people that we celebrate, people that we hear more of, ñu nekk di amee dëkk bi, ñu nekk di liggéey bi, you body don't know. So suñ ci mënee yokk suñ doole, this is an opportunity for us to do that. So we always do Jambar of the week or Jambar of the episode. For me, it's Jaiteh Kaba, as we know him. And, you know.
But I'm not diala.
Because Jambar la
naa ko séddee ak Omar nag because ma ne soldat yi moom
soldari. Why medical terminology be boy? Pass. So parting words.
Wow.
Pam Njie,
Wow, Doc.
the representative of the
Yeah.
Of the community.
of the community. Xam nga Pap lu mu lay def? The questions Pap wants to ask, they're going to ask man. They ask and be laughing. Mr. Coca-Cola bottle.
Yeah. Doc, I think this is one of the most educative episode that we ever had. Xam nga nit yi am na ñoo xam ne dañ am xam-xam waaye duñ ko dee mën a voice out faram fàcce ko. And tey moom macha allah docteur fa naa nekkul ñu ñoo seetaan rek ñun si suñ boppa jàngee nañ si lu bëri.
Facts.
And he is very open to jàngal leen ñu am nañ that interactive conversation. Di ko wax ne rek mu gën a yokka rek. Soxla leen ko te xam naa ne tey mu ngi pave pour ñu am yeneen junior Jaiteh si dëkk bi.
Kañ.
So di ko wax ne rek ñu ngi koo sant di ko gërëm si ñëw bi fii. Despite the tight schedule xam nga mu ngi bàyyi soxla yëpp ñëw. Pour join si campé bi so enjoy nañ conversation bi trop te xam naa ne tamit ñu nekk di seetaan enjoy nañ ko dina serve as a very educative message to all of us. Going back to the topic cancer ku nekk si society bi rek am nga a role to play nekkul na rek dem si hospital bi la. ñun ñëpp mën nañ def sensitisation suñ koñ yi suñ gox yi ku nekk ki nga gën a jege waxtaan ak moom. parce que lii nii dafa am solo. jigéen dafa am solo si dëkk.
ñoo amee dëkk bi.
and su gaay paanee rek dëkk bi yëpp paan. they play a very very pivotal role in our society. donc tamit di wax suñ incredible followers. our constant.
sa soppe.
man moom dama dee bëgg a emphasize a lot on them. they've been very supportive. And to everyone who has been part of this journey so far, we are saying a very big thank you. Gis neen seen support bi gis neen seen messages yi TikTok. Yéen a ñoo gunge comme nu ma ko waxee rek ñu ngi gërëm ñëpp di sant ñëpp di leen jox dig daje ba beneen yoon. Also di emphasize si suñ previous episode bi ki nga xam ne nii rek gis nga si sa bopp rek ñu ngi jégalu once again. Jambar of the week comme ni ko gars yi waxee rek ñu jox ko Dr. Jaiteh jërëjëf.
Man like Bakema.
Yo, Dr. Jaiteh ndaba fala follow baraka. Kontanta bake katarajam bi ay whole lecture di mol. Dr. Jaiteh comme Dr. Badji afanya ni mi yalon ak ko ya bakale pour yaaje. Bi ay wato ta pour kana jang kamol karandi ani mole kacha dal. Ba fala baraka bake fula nyom ba mi follow la mole ko mi yalan ko manta itano Banjul on the 25th gunjur fanam bake kanje free of charge. Mtera Jambar of the week ba dira mo la mi alan ko they went through breast cancer. I know two of my female colleagues me alan ko they went through it and they mo la me alan ko ba manta back. Once again Dr. Abaraka back for coming.
Omar Jonge, Omar 31 years. But happy early birthday, boy. Yang nga dunda de why nga am sa city di sindi sa be yene sa be jaw. Ñaata years?
31.
Pape ñaata
yow ñaata nga am yow du Friday mooy
Ki
sa
31.
birthday bi man 32 xaw ma 33
boy,
33 yaa ñu mag 2 years nga naan ñu
non
tari
booy maa leen mag
Boy,
de
33 yaa ñu mag ke
maa leen mag Omar
waaye ba léegi yéen xale nga moo tax ma la day xuus ndànka
ma xuus ndànka de
xuusal ndànka
naara ma def ndànka kon happy
donc
advance to us
di leen jaajëfal donc maa ngi laa jaajëfal si tey noo doxalee mbiri always excellent baar bi moom soo ko toogee rek moom 100% di gën a jaajëfal tamit docteur Jaiteh di ko wax ne man moom is a pleasure pour moom mu ñëw toog tey si camp bi ndax tey lu mu fi wax rek ku ko dégg di nga xam ne tey xam-xam moo fi génn ndax xam-xam du nit ki lu mu jàng si book rek bon lu mu la ko délivrer loolu moo gën a important si xam-xam bi te tey lépp lu mu fi wax kaamil la képp ku ko dégg dina xamee ne lii nit mënul koo teggi you know so man moom is a pleasure pour man ma toog ak yow si plateforme bi fii ak tey soldaari yaram yi ma fi suma soldaari yaram bi
da nga pass exam
non dafa joxe definition boo xamee ne pour man for the rest of my life du ma ko fàtte
yes te loolu moo am solo
du ma ko fàtte
very important
definition bi to me it's perfect you know daf ko wax and then
block suñu raax
block yu ñu raax
mooy loolu it's a beautiful
am
description
xaat yi foofu noonu yëpp ñu si biir ñama things yi yeneen soldaar yi léegi ñii ñu ne duñ bañ
ak rebelle
exactly so leneen lu mu jëm a wax tamit dafa am ñun benn misconcept buñ am si suñ dëkkuwaay te loolu dog mi ngi lor nit ñi mooy géex bi parce que man suma jabari brother loolu moo ko yóbbu bàyyi 6 months old child da bàyyi xale bu ndaw ñu ne daf ko géex te géex boobu rek kenn du la dee mën a prouval kañ la ko géex ak nu mu ko géexee dañ laa wax ne dafa géex si ween bi dama doon nàmpal ak géex si ween bi mu commencé néew na ñu yóbbu si suñu local nit ñi di mocc
ba mu far dem
for no reason te loolu li yàgg nañ di dégg yi moo tax tey nu mu ko expliqué pour man si léegi laa mën a understand ne te kooku bu mu demee am na yu bëri yu si laxasu tamit you know but léegi laa soog a understand dëgg ne maay bi mun na nekk lii you know so di dellu di ko wax rek docteur Jaiteh di la jaajëfal di jaajëfalaat gars yi di leen wax ne rek tey lii lañ leen yekkaloon parce que xam naa ne lii am na solo dafa am solo
October 1st
waaw October 1st gisu leen di leen wax ne tamit Friday képp ku may wis ma true wave
man lu may wax mooy doo fi celebrate 32 te takkuloo jabar
dama taka di wax suma jàmbaar of the week jox naa ko docteur Jaiteh
te dama bëgga gis nga phrase boobu na demal seeti nañ ànda
ñoo koy gunge kan si gaay
nañ ànda
dog parting words xam ngeen ne man he's so busy te man duñ dee am jot this is probably the most time we've spent just together
live after school
but we still have a basketball match
we do still have a basketball match to play
we're supposed to arrange right
but yeah you know how to talk about it it's quality time it's not quantity
exactly
but parting words doc
I think this campaign you know at the beginning they asked me one last Makampe. I can't remember still. My Hamnane Kampe Bini mom.
You wouldn't forget.
Definitely, this is an unforgettable one.
Yes, sir.
And, Hamnane dog mom. I'll be knocking for a second round of this type of
anytime.
Anytime. Yeah. So great experience. I mean, it's been great, talking to you guys. And Fognane, for me, the biggest takeaway is just awareness creation. I'm going to learn more soon weapon be. And, we've been able to talk about it here, Sikampebi, in terms that, people can relate to. And I think learn more I'm solo. Wahtan mi feeling kodore, why VM. It has to continue in the communities. New set and tamit, they need to make sure that the word goes out. And for me, sun mune am lolu. That's a success already. Just new wahtan. I'm not in toge, si campebi outside here, si Marseille, we need to be talking about this. I'm not in defe lolu in a very short period of time. We're going to see changes. The second thing that I want to buttress on is that this fight, ñun ñëpp a ko moom.
Yep.
You know, and the fact is, ñun si health sector bi duñ ko mën a def just on our own. That's why we had the Solace Foundation to come out, you know, go out to the community. Why even there, we still need the involvement of other people, you know, companies, other civil society. So it's a teamwork. You know, they say teamwork makes the dream work,
Absolutely.
you know, and it's really important, you know, those who are not within the health sector, just like we're collaborating with sports organizations, to know that they're in this fight together. And so in Defe Lolo, we'll be able to achieve the objective that we want to achieve. Healthcare is everybody's business. And that's a very strong message that I want to put out there, that we all have a stake when it comes to healthcare. When it comes to the health of this nation, nobody should be left behind. We should all help pull this wagon to where we want to get to. And Suma, you know, fellow Jambar, I think you guys are doing great. And, you know, come no go sinjeling birek. You know, this is a great way of putting the message out there. And I like the fact that Gori mom, you haven't left them behind.
Nah.
You know, again.
I kid you not, dog.
Yeah, so soon you hear, you know, breast cancer or women cancers, then they fight a Gori. But I mean, here we've been able to highlight Gori, Nyogena, I'm responsibility.
Absolutely.
See, you know, in this fight against breast cancer. And that's a very powerful message. And I hope New Seta and back home are able to take this message and, you know, them to send campaign, you want to
Definitely.
So if everybody who gets up watches the show, so in them send campaign, let them talk about breast cancer.
Let them talk about it.
You know, and I'm sure soon Defe Lolo, you know, the impact we're looking for, you know, would be felt. And just want to thank you guys for, you know, great discussion. But Marco again, I enjoyed that. I mean,
it's a pleasure. Te xam nga bala episode bi doon start ñu doon waxtaan ñu ne as brothers di wax ne gis nga ñun suñ show bi it's a responsibility. Oyafuñ ko is so heavy because suñ dëkk bi ku sigi dafa des si fooy xool soo sigee mun ngaa xool yenn place nga foog ne dëkk bi is upside down like suñ dëkk baa ngi taaka naxar mu ngi bari xeex mu ngi bari division mu ngi bari daf dee daw sa yaram bi parce que ñu bari ndaw yi la dee waaye léegi-léegi mun ngaa sigi nga xool yenn place nga gis ñoo xam ne ñu ngi jéem a liggéey dëkk bi together
And be proud.
xam nga te man lu ma dee wax ma ñun suñ jamono ku mel ni kii tubaab la moo fee toog waaye dañ war a bàyyi xel ne dëkk bi ba léegi am na ñoo xam ne following what's going on the outside suñu eewoo suba ñu ngi seet naka la ñoo taneloo fii su ko defee suñu yàlla yóbboo mun nañoo gestu wax ne suñ jaaraama wàcc na te I think that's the message ma bugg a ñëpp ñu continuer di am soo eewoo suba nu métti kii mënoon naa toog fii mu wax all the challenges yu mu am waaye mu ngi laa woon opportunity bu Gambia am ba pare moom lan la nekk di si def te man loolu ñun ndaw yi sax man dama dee wax ndaw yi loolu ma war a nekk suñ mindset lan leen si mën a yokka loo si wax booy naka la so di just wax nit si tamit ne mutuñ nag so ngeen jégal ñu suñ léegi suñ waxee yéenay mu naxar nit oo ñu tooñ nit waaye campagne bi moom nekku suñ bos askan bi la because hopefully lii lum start ndaw yi ñu ngee déglu ñu ngee am hope ñu ngee am inspiration so once again Dr. Jaiteh, you and the entire team ñoo xam ne ñu ngi taxaw si wàllum cancer di leen jaajëfal suñ viewers di leen wax ne campagne bi yéen a ko moom ñu ngi leen di déglu please share leen episode bi throughout October su ko defee ñëpp mun koo gis ñu ko dee déglu si radio bi tamit waxtaanee leen ko si seen kaabilo yi si seen campagne yi xam nga si place yi liggéeykaay but yes very glad to be back. We need a much love bro t-shirt for the doctor for new officially indoctrinate ko so back here more nañ ko just official much love bro bi right
and I think Omar his slogan is perfect nañ ànd
nañ ànd dafa nekk t-shirt
definitely
nañ ànd dafa nekk t-shirt as well and always suñ partnership once again sponsorship right if you are a company especially if you're a Gambian business and you want visibility for your company. And as long as your company is doing something of value for the society, ñu ngi leen di invite pour ngeen ñëw. This episode was sponsored by Innovarex Global Health, but as solidarity to Solace Foundation. So this episode, Solace Foundation lañ ko ene as well. We'll share the information about the activities. But if you're a company in the Gambia, if you have a business, obviously sponsorship is welcomed. Campe Boise, they're available. We'll make sure it's noticeable. Our partners, Daily Dose, and the entire staff behind Daily Dose, that they're the machine behind Campe Jambal. They're the reason why when we present it to the world, it's quality. Dilen Jaiteh. Doc, we have a saying at the Campe
Right.
that, I told them you could say, I love you. But this is our official Much Love Bro t-shirt that now we're indoctrinating Dr. Jaiteh,
Wow.
aka into our shirt. So thank you, brother.
Man.
It's a pleasure.
Much appreciated.
There you go.
Thank you.
Bebe Nenyon, we're out.
Love, yeah.